Hello, everyone. My name is Dr. Alex Barbuto. Thank you so much for joining us for this webinar, Unlocking the Military Match, a live question and answer panel for medical students pursuing military emergency medicine. We've got a great group of panelists today. Due to some technical difficulties, we're re-recording the first few minutes of this, but you'll be seeing our live panel here shortly. So there's some standard disclaimers. USAAM, although a group of military physicians, has no official affiliation with the US government. These are just our own views and not those of the Department of Defense, the Defense Health Agency, or any of its constituent services. Additionally, although many of our panelists do sit on the selection board for residencies and fellowships, what is said here is not official policy or positions of the board. And so make sure that you're contacting your service-specific GME office for any up-to-date policies. And we have no disclosures for today. First, a brief word about the American Academy of Emergency Medicine, and specifically the Resident and Student Association group of that. I think it's important for all of our medical students who are considering emergency medicine to join a major organization. It's very inexpensive, but gets you some resources that are useful for students, as well as getting you a sense of what's going on in the big picture of emergency medicine. What are your attendings dealing with out in the world? And how can we as a specialty grow, advocate for ourselves, both with government and with hospital groups? There's also a lot of speaking opportunities at their annual conferences. If you are a member of the Resident Student Association, you can join the Uniform Services chapter for free. In addition to webinars like this, we have some other opportunities for speaking, including at our scientific assembly next year in April in Seattle. We have had medical students present there before, in addition to residents and staff. And once again, it's free for students, so easy to join. So for tonight's panel, we have a couple of rules of the road. I will ask our discussion to, of course, be respectful for one another. And then if we're going to do some breakout rooms for each of the services specifically. So if you've got something that is very specific Air Force question, save it for that. So try to avoid any questions that are really specific to you. Additionally, we offered the opportunity to speak to all of our emergency medicine residencies that are in the active duty. We do have a couple of our civilian partners here as well. And so we'll introduce those panelists now. So once again, I'm Alex Barbuto. I'm an attending at Walter Reed, and I'll be moderating the Air Force room. And we have our list of our others. Most of these individuals are either program directors, clerkship directors, or vice chairs of medical education, I think is a couple of our titles. And in addition to all of our uniformed officers, we do have, again, two individuals from civilian residencies, Dr. Parker from UT San Antonio and Dr. Gannon Sungar from Denver Health. Last year, we did a similar webinar, and I would encourage you to check out this link on YouTube to watch. We have a lot more details about interview days, things to do or not do on your rotation. So I would encourage you to watch that. But if you want kind of the highlight reel, one of the big do's and don'ts are on here. So a big piece of advice is always ask for expectations on shift. So when you show up, be on time, and talk with the resident or staff that you're working with. Hey, how many patients would you like me to see at a time? How would you like me to present? Do you want a full HPI? Do you want boiled down basics? Do you want me to tell you my differential first? Ask about those expectations. When you're between patients, use this opportunity to learn more. Every patient can teach you something new. And so, when a patient says they're having chest pain, go look at a resource about all the differential diagnosis for chest pain. When they tell you about some medications that they're taking, read about those if you haven't heard about them before. Other things that I would recommend, do try to attend any of the scheduled social events. You may not be able to make every single one, but these are great opportunities for you to get to know the residents outside of work. Get to see if it's a good match for you. They'll get to know you a little bit better too. Always, always, always have appropriate military bearing. Wear the right uniform, be clean shaven for gentlemen, have jewelry or accoutrement that are within standard when you're on shift. Make sure that you're doing any of your admin tasks on time. If your clerkship director is asking you to do some paperwork before you show up, please do so. You don't want to be the person that they remember because they had to email that you 4 or 5 or 6 times reminding you to get something done. It's really important that you just knock those items off. And it's always, I think, good to ask for feedback, both on shift, mid rotation, and certainly at the end of your rotation. While you're presenting to your staff, ask them, hey, how was that presentation? What would you like me to do differently next time? If you're about halfway through your shift and you're feeling like things are going great, you can ask, hey, I feel like things are going well. What do you think? Or if you're feeling like things are not quite jiving, you could ask, hey, I feel like I could do better with my next presentation. What advice do you have? You may be really, really busy, so use a little bit of tact and know when asking for feedback might not be at the right moment. Some things you really want to avoid. This is not the place to have arguments with other doctors, with nurses, with other staff members. All of those things, get back to your program directors. They don't want to hire somebody who's just going to be fighting with people on the floor. If you feel like your faculty is providing some other differential or plan than what you might have thought, ask, hey, I would have thought doing this, you're thinking that, what's making you think that? As opposed to saying, hey, faculty member, I think you're wrong and I think I'm right. Should be self-explanatory, but try to avoid any romantic relationships while you're on your rotation. People are late, we get it, but if you're going to be late to shift, make sure you let somebody know so that, one, they know that you're okay and that you're not missing, and two, so they don't think you're just being lazy. We get that there's traffic and other things that get in the way of getting in on time. Like I mentioned earlier, every patient can teach you something. Don't ever avoid a certain type of patients. If your staff says, hey, there's a new patient to check in and they've got upper respiratory tract infection symptoms and you've already seen a couple of those, don't say no. You can always learn something new. And then another thing that we notice a lot is try to avoid spending too much time on your phone. We know that they're a great resource. You're probably looking up clinical scoring system or maybe reading up to date. But if you're just kind of always glued to your phone, we get a little concerned that you're not as engaged with patient care. So just be mindful of that. We also had a lot of discussion about interview day. First and foremost, make sure you confirm the date and time that you're going to be doing your interview, whether that's virtual or in person. Be on time in the right uniform. And again, up to those grooming standards. No one's going to be out there with a ruler checking where your pins are, but you should be generally correct. We want you to be yourself, but be engaging. If you're just kind of flat and uninterested, that really leaves a bad impression. While we want you to be comfortable, you also need to be professional. It is possible to be too casual. You shouldn't be sitting down with your legs splayed open, your arms up behind your head, having a conversation with your program director. But we want you to feel comfortable. We don't need you to be rigid and robotic. So finding that happy middle ground, it's a big middle ground, but try to stay in there. Like I mentioned, totally acceptable to do virtual interviews if you didn't rotate with a program in person. If you're able to go in person, that's great too. But I think we've all learned over the last few years that virtual really is an acceptable alternative. You will not be able to rotate at every single site, most likely. And I think it is important still to apply to and interview at every site that your service offers. Like I mentioned earlier, we are going to have these service-specific breakout groups, and you'll be able to watch the recordings of all of those. This is a great place to ask any of those service-specific questions. In particular, if you're thinking about applying to civilian programs, because that process is really unique to each service. And then similarly, I think if you have any questions about matching with a significant other, whether dual military or military and civilian partnership, I think those are probably better handled by the services just because the options are so different. Next up, here's some contact information for our panelists. I'll leave this slide up for a few moments so you can take down any of that information. And with that, we'll go into our first set of questions. So our first question was, is it too late to schedule a rotation? Chances are it's a little bit late. You might still be able to reach out and find something that works. But for the most part, our panelists recommend starting scheduling your interviews as early as January, but potentially by March, things are really starting to fill up. there can always be little gaps that work out. So reach out if you're really struggling to find places to rotate. People often ask, how short is too short of a rotation? Most sites will not allow for any rotation that's under 2 weeks. They might be able to have you come and shadow for 3 or 4 shifts if you've got some time and you want to see the place in person. And I think that could be a meaningful experience, both again for that you get to know the program, but the program to get to know you. Even if it's just 1 or 2 days on either side of an interview, that can work too. But don't expect to be able to schedule a rotation that actually gets clinical credit if it's less than 3 weeks. And if you're in your 3rd year, again, good time to start reaching out December, January to our programs. There's some resources online and you'll be able to see those in the chat for that. So on shift, how many patients should I carry at a time? I think this is our first question that one of our live panelists is going to answer. And so I'll have Dr. Tom Frowley answer that question for you.
Yeah, I think, we have different locations in our ER and we're staffed a little bit differently just as a big center. I think that my recommendation would be that you talk to your senior resident that's on shift and you also talk to the attending that's on shift and ask them that question. I think there are some times that we could give students leeway to carry, 2 or 3, 4 at a time if things are moving relatively quickly. I think there's probably other times where I would rather see somebody carry 1 or 2 that are a little bit more higher acuity and really focus on them, make sure that they're staying up to date on all of the lab values, all the imaging coming back, any clinical change that happens, and really staying up to date on those than I would, taking 7 or 8 low acuity patients. So I certainly think that there's variability with that. And I also think that the patient volume each day will change, and kind of staying up with your senior resident and your staff at that time would be the best way to figure out where you should be going in that direction.
The first time we came up with thanks. Other comments from the faculty out there?
Yeah, I agree with Dr. Frowley 100%. I would also add it shows a little bit more teachability. If you take guidance saying, we cannot handle you seeing any more patients at this time, if you could continue on with the patients that you have, then for you to take the initiative to try and see more when we've asked you not to. So that is nuance, but it is one of those, can you take direction? Do you listen? Do you understand that sometimes we are seeing something from a higher perspective than you get to see? And that sometimes it's not all about the medical student who's rotating through, it's about the safety of the entire department.
Yeah, I think that's a really important point. So being teachable, listening to the subtle hints, or maybe not so subtle hints sometimes, is really important. Dr. Schmitz.
Yeah, the feedback I generally give students is we typically have 4-week rotations, and the kind of a rough guideline is that the first week you're seeing 1 patient at a time, the second week you're seeing 2 patients at a time, and by the 3rd and 4th week it's usually 3 to 4. But completely agree with Dr. Frawley that it just sort of depends on the shift. I just did a night shift and we saw 40 plus patients with the residents. So if the resident's getting overwhelmed and they can't see anymore, I'll have a student just present directly to me. But that's where I think your opening point about checking in with expectations at the beginning of the shift of kind of, what are your goals? But that's the feedback we give students. And we do sort of assess them on their ability to multitask and manage multiple patients at one time, particularly the second half of the rotation. So that's kind of a good guideline.
Thanks. And again, for all of our students, if you have any questions, feel free to put them in the chat or raise your hand, and we'll happy to answer those. So when I'm on getting ready for my audition rotation, what are maybe some good resources that I could look at before my rotation or on rotation if I want to learn more about my patients? Dr. Roth, do you have any thoughts on that one?
Sorry, can you repeat the second half of that question for me? Kind of cut out a little bit.
Yeah. Any thoughts on resources that are good for either on shift or preparing for my rotation to kind of learn about emergency medicine, how to take care of our patients?
Yeah, absolutely. So, obviously basic text, but there's some more specific resources that, if you want to do some reading, the Wiki EM page is pretty good for quick ability to look things up on shift. It's got a nice bullet point format. Some of the, obviously, there are case files for the emergency department, those type of things, the medical student directed textbooks. If you feel so inclined and your school supports the opportunity to access more of the primary literature and you want to start looking that stuff up, that can be helpful as well. And as far as like emergency medicine landmark studies. So yeah, and open evidence, I've actually started to use that as well, which is great because it'll cite studies for you in the notes down below. So then if you feel so inclined, you can also look at the primary literature where the recommendations are developing from that. But your Rosens and your Tintinality emergency medicine handbooks, they both have kind of a truncated version that's a good quick reference as well for that. But sounds like everybody else has a whole bunch of all the resources. MRAP is great. Student discounts and stuff as well for that. So I think those are all worth the money as well. I'm a subscriber to those. So
Awesome. And thanks for those other resources in the chat there. I see that question. So my school advises us to apply to civilian programs at the same time as the military match. What suggestions do you have while interviewing at civilian programs, perhaps in October through December, as far as disclosing my military service and how to make sure the civilian PDs don't feel like I'm wasting their time if I'm trying to military match? Any of our program directors feel comfortable taking that one?
I can take that one.
Right.
I think transparency is the best approach, and I would just reiterate to them, explain your service. I would be forthcoming with your preferences. My preference is to train in the military, my preference is to train in the civilian match, and then say, you're waiting until December 15th or whatever time the list comes out, and then follow up with them no matter what. If you match in the military program, follow up with email, because EM's a small world and you're going to run into these people again at future meetings and organizations that are going to be involved in. People are very open to that. I trained in a civilian program, and so I had that conversation a lot. And the other thing I would say is talk to your mentors, talk to your specialty leader or consultant in the Army and the Air Force, and kind of get a feel for like what that year looks like. It fluctuates, like how many opportunities there are to train civilian, and that obviously affects your chances of where you're going to match. And so I think communicating upfront with everybody, being transparent, and then closing the loop so people don't feel like you're wasting their time is probably the best approach. I think if you're really gung-ho on training in the military, which is a great place to train, I would probably push some of those interviews as late as possible, because one, then you're not wasting time, money, travel, and you're not, again, taking up an interview spot from somebody who might otherwise want it.
Yeah, I think that's great. And I love the conversation in the chat there about how late the civilian programs are doing their interviews. So it seems like most are trying to finish up early to mid-January. So there is a little bit of room between when you would find out about a military match and then. Dr. Chin?
I was going to just say, from the Army perspective, if you're applying, you should generally have a civilian application. One of the challenges is we will send a number of resident or future residents to civilian programs, and you don't find out that you're going to do a civilian residency potentially until mid-December. And by then, if you haven't put in an application, you may miss some significant interview opportunities on the civilian sector if you then apply after you find out in December that you're slotted for a civilian spot. So it's worth considering applying, even if you are pretty sure you would not do a civilian spot, unless you're willing to not train that year specifically.
Thanks. Dr. Murray?
I just want to add, in addition to applying to civilian EM programs, she's probably applying to civilian transitional year programs. If the military doesn't match you, and that happened to me my first time through, they could give you a deferred civilian TY transitional year. And applying mid-December to transitional years is a very uncomfortable spot to be in from personal experience. So it's prudent to put in applications to transitional year spots ahead of time, and hopefully you withdraw those applications, but having them there and being able to interview ahead of time is useful.
Dr. Parker?
Yeah, I was going to say, as a civilian program, we can see on the application if you have military requirements. We interview those people pretty much in line with anybody else, and that's actually how we led to getting active spots. Is we had several civilian-sponsored residents that were excellent candidates, and so then we worked with the Army and Air Force to actually get active duty spots.
All right, I might have our kind of this discussion end up kind of going into the breakout rooms if there's additional follow-ons, because I think there is going to be a lot of service-specific nuance to this one. But I appreciate that conversation. I think it's really important that people keep their options open. Don't close the door on yourself as you're going through this process. A question that came up last year, and I'm actually not sure how it will be answered this year with residency CAS instead of ERAS, is signaling a thing for the military match? Otherwise, how do I indicate my interest? Maybe Dr. Schmitz, you answered this question last year, and so I might pitch it back at you. So I think you did a great job describing that.
Sure. So signaling is really meant more for the civilian match, and my civilian cohorts can really chime in here. But I think the rule is you can chime up to 5. The general recommendation is that you not waste a signal on your own home institution. Like if you're at a civilian, program currently, it's sort of implied that you will get an interview there. It helps the program directors really narrow down when they have thousands of applications. Which 100 are they going to interview if this someone is really serious in my program. For the military, I don't think that's really necessary, and there may be some specific nuances to it. But it's a much smaller kind of pool. We all sort of know each other. Like for the Navy, there's only 2 residency programs, so there really is no indication for signaling per se. I think it's best to be transparent, and if there's somewhere you want to train or you have a family connection at one place, of just being open about that in the interview, of letting them know. But it's not a formal process like it would be in the civilian match.
All right. Great, thanks. I see that's kind of a corroborating instruction there for not applying or not signaling your own institution. All right. Again, if you have any questions, feel free to put them in the chat or raise your hand, and we'll try to get to everyone's questions. So maybe Dr. April, as a brand new program director, about to see all these medical students, what is it that you're really looking for in rotators during the rotation?
Yeah, thanks. I think when I was a medical student, I figured what PDs were thinking was very performance related, some remarkable amount of medical knowledge or expertise. And honestly, I think it really more boils down to the fit for the program, the relationships that we see you building. Um, I think we all choose our medical specialties in large part because we feel like we have found our people. And I think residency is really quite similar. So each of us has our own culture, milieu, if you will, and we just want to see does this feel like a good fit for you? And that goes both ways. We need to be a good fit for you, just like we need each individual resident to be a good fit for the organization. So to kind of circle back to your initial slide, which I thought was spot on, encouraging everyone to attend social events. I'll be honest, I'm very introverted. I struggled with that as a medical student, and I certainly wouldn't want to broadcast to anyone that we wouldn't, gladly welcome in folks that might be a little more introverted. But the reason why that ends up becoming so important is because it shows us what those interactions would look like. These are people, these other medical students you're rotating with, are potentially folks who you are going to spend many years of your life with, having some of the most profound experiences of your life. And we just want to make sure that it looks like this is a group of people with whom you're going to be able to connect in a positive way.
Thanks, sir. Dr. Sungar, what are your perspectives on things that you're really looking for in your rotators?
Yeah, I mean, I think I agree with what's been touched on. I always say we can teach you the medicine. What we can't teach you is to be professional and to have a growth mindset and to work hard. And so that's what we're looking for. I think we don't expect you to be able to put a chest tube in on your first day as a rotation. What we expect you to do is to follow direction, be committed to your patients. I think one of the biggest areas that we see problems in our rotators, or that can be a pitfall, is folks showing up and thinking they're going to get into residency because they kind of endear themselves to faculty or to senior residents. And that's not going to hurt you. But what we care most about is that you're taking great care of the patients to whom you're assigned. And so I really would put the focus on serving the patients that you're caring for, learning and proving that you can work hard and get better over the course of a month.
Thanks. Dr. Murray?
Yeah, I would say teachability also. The ability to take that feedback well, and then apply that feedback to the next patient is critically important. I don't care if you know the medicine yet. That's not what I don't expect you to know it. That's what residency is there for. But being able to be taught and to learn, have that growth mindset, that's the most important thing for me when I'm looking at medical students.
Thanks so much.
If I can chime in briefly, I would encourage
absolutely.
the students to recognize that government hospitals are not inherently efficient. There is no department in the hospital that will function well or efficiently. And I know sometimes you're coming from medical schools or hospitals that are quite efficient, and they might be able to get you in and out of different offices. But during your in processing, out processing, and even when you're on shift, that's just not going to be the reality. And so I have had scenarios where students will come in and they're very frustrated by delays and when things take longer than they should, and they'll vocalize their concerns loud enough that the people who deal with it every day and bear with it every day, they don't want to hear that. And so I would just encourage you to be patient as you're working through the systems. And if you can't fix the problem immediately, then I would probably say just kind of grin and bear it and ask if there's anything that you can do to help. But otherwise, I would encourage you to not complain about government inefficiencies as you enter the government system.
Yeah, I think that's an unfortunate reality that many of us have handled with or without grace over our years. I see some great discussion in the chat about the proposed move to 4-year residencies, and I see a lot of answers in there. We really don't know exactly how it's going to look, and so there might be some service-specific stuff that we could maybe expand on, since our Navy programs are both 4-year already. Correct? San Diego, both 4-year? Yeah. Okay. And so I think that'll be a little bit service specific, but I do recommend you take a look at the conversation in the chat. All right. So we talked about what people are really looking for. What are some red flag things? Like what, as a faculty member, that you would see and say, holy cow, we can't have this person in my program? Maybe Dr. Phelps.
Sorry, I was just laughing because Dr. Riddle's statement kind of highlights what I am not looking for. I am not looking for somebody who blows off my administrative office. My coordinator is fantastic. She does not get paid nearly enough for what she does, and she really treats all the residents with love and care. And so if she's having to personally like ping you 15 times for the same packet of information, I'm going to say that's probably going to be a hard pass for us. If you can't handle the administrative burden of just answering an email, then that's going to be really, really challenging when you're working shift work and you're working at 11 different hospitals and you're still having to answer clinical notes and other things. So for me, big red flag for me is if you are blowing off any of the ancillary staff, the medics, the nurses, just to try and look good. Like if you're trying to like throw them under the bus to look good to your senior resident or your staff, that's going to be something that we pick up really easily. It's a really small network. I've worked with a lot of these nurses for the past 15 years. I trust them implicitly, and they have a voice when we do our residency selection to a degree. They get to weigh in a little bit. So I would say just you never know who is judging you. So treat everybody with dignity and respect, regardless of their rank, or irrespective of their rank. Sorry, and just really try to be a team player and put your best foot forward.
Thanks. Dr. Parker, any other red flags that you would see in a rotating student?
The students who don't take ownership, if they want to pass the buck or if they want to blame somebody else, is really a red flag for us. We want people to show up and work hard and to help out. We talk about being a team and a team environment, and that means everyone has to do their job, and sometimes you have to do somebody else's job. If the patient needs to be turned, if the patient needs to be, helped to the bathroom, those are the things that the people who stand out to us are the ones that are willing to do those things, instead of complaining about it.
Thanks. A question in the chat that's already, I think, been answered, but since most military residencies are combined with civilian programs, if we don't match for a military spot, could we get a second chance, second look with those programs to match through residency CAS as a deferred or civilian sponsored? It seems like at least at Nellis that is a thing, and it's happened a lot, although it does depend on whether you get a civilian deferred position versus sent into a TY position. So I think the answer is yes, although there's a bit of a caveat.
I would say it's probably less likely now, specifically with us, now that we have 6 active duty spots versus 2. But in the past, we have had the same applications kind of come across through ERAS that we've already interviewed them. And to answer for the second look thing, typically we don't do that. And we're not going to re-interview you. But we have had people that we felt would be good matches and have gotten civilian deferred spots and subsequently matched to the program as Air Force civilian deferred. So
thanks. All right. So we've got, is there a top preference for the type of letter of recommendation? I've heard that SLOs are preferred, was not sure if a letter from an EM mentor or something programs is something that programs like to see in addition to SLOs. Dr. Mitchell, I'm going to take the letters of recommendation and types.
Yeah, happy to do that. I think that the way you want to look at your overall packet is how we get it all in one lump sum, usually after your interview. We get it about a week or 2 after you rank. And so when you're looking at your letters, there's a lot of very general language in most of the letters. But I'm going to look at the letters in the context of your entire application. And I'm really looking for, red flags first. So if a letter says, language like, hey, this person would be fine. This person requires some supervision. They would require some development. That's a letter that you probably don't want in your file. So I think to start with letters is you should really talk with the person you're asking to write a letter and ask if they're willing to write you a good letter. Do they know you and are they willing to write it? Because if they're not willing to write you a good letter, then you need to reconsider whether this is the right person. I do appreciate seeing letters from emergency physicians. We're all going to have some colleagues and some mentors outside of emergency medicine, and that is okay. There's value to a longitudinal relationship, whether that's a research mentor or just a clinical mentor. But I really want to see letters from people who know what emergency medicine is and can talk about the specialty and your attributes and how they might marry up. Does that make sense?
Yes, sir. Thank you.
Dr. Schmitz.
I would say it kind of depends. On the civilian side, very much they want to see a SLO. A handwritten letter from somebody or even an emergency physician won't carry nearly as much weight. There's different types of SLOs, and for those that are not familiar, the SLO is called the Standardized Letter of Evaluation, and it's essentially a template. It's not meant to necessarily be a recommendation. It is truly an evaluation, and it sort of ranks the student relative to other people who have historically rotated through the department. So it's a lot more meaningful because it has a lot more data in it. And I think for the civilian match, I would absolutely try and get a SLO. For military programs, it may depend. I know I can speak for my program. I would prefer to see a SLO than just a letter from an emergency physician. But I know there are a number of sites that have emergency departments that don't necessarily have residencies. There are a type of what's called an O SLO or an other SLO that they can do for those as well. But the faculty of those programs may not be as familiar with those different types of forms. So what I've told my students, that if they are in that situation and they have someone who wants to write them a letter, but they don't know how to access the SLO, is to put me in touch with them and I can give them the information for cord. But I think I would ask each individual program really what they're looking for. But definitely for the civilian match, you're going to want to have the goal is really to have 2 slows for your application.
Thanks so
Yeah,
much.
if I can put this into perspective, I mean,
Yeah.
as a student, if you can understand that every packet that has a non-slow letter of recommendation, they are all glowing letters from people that none of us know. And so it's really hard to distinguish one letter from another letter. Whereas the slow is written by people who have a profile and they have a vested interest in their name out in the academic world behind that letter. And so the PDs and the CDs are putting their name on it and they're saying, this is my pet, like last year I broke the students out in this number of what percentage I felt like this person was or how they ended up in my rank order list. And so there is like fidelity to a slow. It's not to say it's wrong to have a letter, especially like Dr. Mitchell was saying, from a mentor or somebody who knows you really well, but just recognize it's not going to carry the weight because it's very difficult to interpret when every packet has a glowing letter from somebody.
Thank you, sir.
So when it comes to the end of my rotation, how do I ask for a letter? Does a slow just automatically happen if I did a rotation with you? And maybe I'll direct that at Dr. Ponce.
Yeah, absolutely. For all of our rotators, we tend to generate 2 things. So we will generate both their medical school evaluation. So when you come and you check in, the first thing we ask you is like, who do we send an evaluation to and how do we do it? Because we do that for, medical schools across the country as well as USIS. And then we will ask you, do you want to slow or not? And what we have found is that there's some variability in students who will initially say they don't need a slow and then later they want to slow. And so we kind of prep that paperwork so that come October 1st, when there's like a scramble and you come back to us and you say, hey, I changed my mind. I really do want to slow based on that rotation. And so we're kind of set up and prepared to take to generate both of those, both your medical school evaluation as well as a slow. And then we may not, if you don't ask us to submit it anywhere, we won't do anything with it. So we have it prepared based on your evaluations and your rotation, and then we will kind of rank them out, put in the data that Dr. Smith was talking about. And when you then will tell us, hey, please send that to the CAS system, please send that to mods, or kind of wherever you want it to go for your application.
Thanks so much. So again, be clear with your programs, what you're looking for and where you need it to be sent. In the chat, there was a question about, is there a maximum number of slows and letters in the application? The answer was 1 to 2 slows is probably fine. If you rotate at 3, you can have 3. Most people will have less than 3, however. And then there's also an example of what slows look like. So you can click that link and see exactly what we're talking about. Also in the chat, so this was an Army question, but if you have to complete DCC and BOLIC right after 4th year, but before residency, does that hurt your chances of matching compared to someone who's already completed that? And the responses were, it should not affect your match, although there are some other kind of side effects of arriving late. I don't think it's going to affect your chance of matching. But that was in the chat as well. All right, we're going to head to our breakout rooms, I think, in just a couple moments, but I wanted to give a chance if there's any other questions out there. So good evening. So I know for military residency, we apply through mods. Do we also use mods to apply to away rotations? So do you use mods for rotations? The answer is no. You generally are going to reach out directly to the programs or the hospital's sort of education department. A great question. All right, we'll give a couple minutes for any other questions in the chat. Well,
I was going to say for the joint programs, at least for Las Vegas, they also require you, if you want to rotate at UMC, which is the primary training site, you also have to apply through VSLO, in addition to scheduling the rotation with us.
Thanks for that. And while anybody's kind of ruminating on maybe another question they want to throw in the chat, can my actions off shift affect my application to your program? And maybe Dr. Frawley, because your smile is the biggest.
Yes. Is that a good enough answer? I think going back to what Dr. April said and what you kind of pointed out in the middle or at the beginning, sorry, with go to those off site or away from the hospital get-togethers that the program will be having. Those are great times to get to know people, for people to get to know you. Just make sure they're getting to know you for the right reason. That might be the fastest way not to match. I think I would rather, as you know, Dr. April said, I would rather have somebody that is far behind on medical knowledge that we can teach. If you are perceived that there will be a problem from a disciplinary standpoint, that will go straight to the bottom of, I think, most people's selection list.
Thanks. Dr. Phelps?
I would add, I don't remember if Frawley was here for this or not, but if you arrive to shift via military police because you were speeding, like going 80 in a 25 kind of thing, the military takes that very, very seriously. That's another way, like to if you end up getting the police called on you while you're at rotation, regardless, like it please be careful on how that'll last with you for a long time.
Any other sort of military professionalism things that maybe people who have not had some prior service, anything else you want to share?
I would say, oh, sorry, go ahead. I was just gonna say, I think we probably all have like one memory in the last 10 years where there's been like a very notable medical student. But I think more common is maybe someone who's not as familiar with the military, which would be me before, I started my whole career here. And it's a great opportunity to show that you are teachable and you can ask questions. So for like guys, sorry, it's super obvious if you show up unshaved. And like when you look around, you can see everyone else is shaved, and you could ask a senior resident or a junior resident, like, hey, what am I supposed to do? What am I supposed to wear? Where am I supposed to go? And I think that just shows us those students who will take that initiative and have some situational awareness. We don't expect you to know everything about medicine. We also don't expect you to know everything about being in the military. But if someone tells you, hey, you're an officer on shift, our junior enlisted are looking at you, and you right now are not looking or behaving like a naval officer, and then you do that again 3 shifts later, I think that is also kind of a signal to us that either you're not teachable or you're not paying attention, or maybe you don't care, or maybe all of the above. And so I think that's just like one thing to remember. Nobody has a problem if you ask questions of how to be in uniform and what you're supposed to do. And so ask those questions, seek those people out. People ask me sometimes what uniform to wear, which is totally fine. I'm happy to answer that question, but so are our senior residents and our junior residents that you'll meet. And so ask your fellow medical students. They maybe have been on rotation somewhere. And so it's a great opportunity to show that you're teachable and can learn and kind of pay attention to your surroundings.
Thanks. I think these are all really good lessons. In the chat, is it an expectation to verbalize your top residency location prior to setting your rank list? The answer, no, it is not required, and programs really should not be asking you. However, you are always allowed to share what you want. And I think that people are going to have different advice. I know that for me, I think transparency is really helpful. If there are reasons why you really wanted to be at a place, I think it's perfectly fair to share those thoughts. But let me pose a question to the group. Let's say I'm really eager to match. I don't want to go to TY year. I want to match in the military. So I tell all 3 programs or both programs or whichever might apply that they're my number 1 choice. Is that going to haunt me later? And they all,
Dr.
Hey,
Barbuto,
I would
go ahead, Mike.
I would strongly recommend against that. So you are about to enter 2 professions, the profession of medicine, the profession of arms, and both of those professions place an incredible premium on integrity, and it's not worth it. Dodging a TY year is absolutely not worth compromising your integrity. And even if it were over the long run, yes, I believe it will come back in a negative way. So again, to reiterate Dr. Mitchell's point, we should not be asking you where you're planning on ranking. That is entirely up to you to share that information if you so choose. But please, whatever you communicate, make it truthful. That's all I got on that.
Dr. Mitchell and then Dr. Phelps.
Oh, Dr. Phelps, you can go ahead.
I just, I love that Mike went with a very professional approach. I'm literally texting Chris right now while this is going on. We're friends. We've been friends for a really long time. I've known most of these people in the game. Like, we talk about you guys. And while we absolutely want to support your family and your growth and everything. So if there's like, hey, I'm dual military and we are trying to match at BAMC because they have the program that my spouse is trying to apply to. Fantastic. I want somebody to be at the program with their spouse because I know that when my residents are dislocated from their spouses, it makes for really unhappy residents. So we want to support you, but lying to us into our faces, like, we find out about it. It's a very, very small circle of Army education and military education. I mean, I've sat at GSA step across half of you people as well. So we find out about it. And while you may end up with what you think is your primary goal, there's a lot of influence that we have in your career for the next 3 to 5 years. And it can be challenging to overcome that initial introduction.
Thanks. Dr. Ponce?
Oh, I was going to echo most of that we want you to be successful, and you're successful not just based on the program you train at, but where your support network is. And so plenty of people will disclose, certain factors that lead to one coast or the other. And, Portsmouth and San Diego, we're looking for like the 20 best EM interns we can find. We're not looking for just like 10 grade at one site or the other, because you're all going to join our same small community of Navy EM. And, like Dr. Phelps said, we want you guys to be successful, and there's a lot more to just a program than like, we want you to be successful in your geography as well as, in your training program. You're going to be a great ER physician regardless of where you train.
Thanks. I think that's an awesome final point to make. No matter where you match, these are all fantastic training programs. You're going to be well prepared, and you get to join, I think, one of the greatest communities of emergency physicians. And so I think with that, we'll go ahead and head to our breakout rooms. A quick reminder to my co-moderators, make sure you hit that record button when you get into your breakout rooms. And we'll go from there. There's no specific end time. So however many questions there are, however long that goes, we can keep these breakout rooms open. So I'd like for each of the programs who are represented here to just kind of briefly introduce yourself. So where you are, what your role is there, kind of the size of your program, and how many of those are military versus civilian. And for the military ones, like, are any of them coming out of the TY GMO area? And then maybe 1 or 2 strengths about your program. So Dr. Roth, do you want to start?
Sure. I'm Taylor Roth. I'm the military program director or a joint program with UNLV/UMC, which is the county hospital and the only level 1 trauma center and burn center in the state. We're affiliated with Nellis Air Force Base, although our residents, both military and civilian, spend 1 month a year rotating on base. So we're in Las Vegas, in case that was, sorry about that. This is where Nellis Air Force Base is for all of you. But I think the strengths of the program, it's county hospital, very challenging and very sick patient population for sure. We have decent opportunities to present or participate in a lot of unique event medicine. Las Vegas is a very big site for all of that stuff, and so I think as my time as a resident here, I feel like the closest experiences I got to when I was deployed was working things like Burning Man or Electric Daisy Carnival and those type of low resource environments with pretty high acuity. So those are just kind of some of the strengths, brief overview, but any specific questions, I'm happy to answer as well.
All right. Dr. Murray?
Hey, so yeah, I'm Dr. Murray. I am the program director over at Wright-Patterson Air Force Base. I've been there now completed 6 years in the program. We are joint civilian military also. We're combined with Wright State University. They have 8 residents a year, and we have fluctuating somewhere between 8 and 10 military residents a year. We're going back to 8 residents this coming year. We do spend a month each year on base, although the first year it's a dedicated block. And second and third years, it's a longitudinal experience where you spend 1 to 2 shifts every ER block on base. We primarily work at the Premier network with the only trauma level 1 for Dayton, with a good catchment area. We have a burn center at Dayton as well at the Premier site. And then we rotate out several of their community outlying hospitals as well, some smaller community hospitals and some freestanding hospitals, and some pretty busy places, including down Middletown, which is where Hillbilly Elegy is actually written about. I think it's a great place to train. Yeah, that's a little bit of our program.
All right, Dr. Sungar.
Yeah, I'm Gannon Sungar. I'm the program director at Denver Health. So we're a civilian program with up to 2 active duty spots per year. So we have 17 residents per class. The 2 active duty spots would be included in that 17. And we're a 4-year program, so 68 total residents. We're based in downtown Denver. Denver Health as a hospital was founded 16 years before the state of Colorado. So we have a long history in Colorado. And I think similar to Dr. Roth, we're a county hospital, very kind of serve a very vulnerable urban population. I think obviously I think there are a lot of strengths of our program, but one in particular I think is the breadth of exposure you get. So our residents are based at Denver Health, but we work at 4 different hospitals: a community hospital, suburban community hospital, and then Children's Hospital Colorado, which is the top 5 children's hospital in the country, and then University of Colorado Hospital, which is kind of a giant academic tertiary quaternary referral center. And so, our residents are exposed to chronic unidentified disease in vulnerable populations. And then they also get to see patients on experimental chemotherapeutic drugs and LVADs and all the rest of it. So you really get to see the entire scope of emergency medicine.
Awesome. And who do we have from BAMC?
Hey, I'm Dr. Espinoza. Can y'all see me?
We do.
All right, good. I'm now a second year staff. I graduated from Wright Pat. So I'm starting my second year here. I worked with Dr. Murray, who you just heard from. But yeah, BAMC, we're based in San Antonio. We're the only level 1 trauma center in the DoD. We see about 80,000 patients, 80 to 90,000 patients a year. As far as MTFs go, I would say that we definitely get a good amount of acuity in the MTF. Our residency is 18 residents per class, almost half and half Army Air Force. This year we're incorporating our first Navy resident. So that's going to be awesome to have that going forward as well. Strengths, we're in San Antonio, we're going to see a lot of pathology in San Antonio. We do rotate out in the community, several different hospitals, Baptist Health, Methodist. We rotate at different children's hospitals throughout Texas. First year, they go to Houston. Second year, they're here in San Antonio. Third year, they're in Austin. We do have a good operational med tract. They rotate out in Honduras, do kind of austere medicine out there. There's a lot of opportunity here for people to get involved, and there's a lot of education. So lots of strengths going on here.
Thanks so much. And for the group of the 4 of you, what other sites for active duty Air Force are there? Because I know that there's a lot of onesie-twosie sites. What else is out there? I'm not sure who knows the broadest answer to that. Maybe Dr. Roth or Dr. Murray, but
Sure, I can pipe in. So there is an operational emergency medicine track where you get embedded in a civilian center. There's multiple sites across the United States, including the Ohio State University. You are in a sponsored position there, so you're active duty. You're not in a deferred. And I don't know if you guys necessarily know the difference between that, but it means you're paid a full salary and you have all of your benefits of being active duty, and you accrue time towards retirement. The caveat is that you have to do flight medicine afterwards, and you go into a flight medicine billet. And you might get a really cool job, or you might go and be a flight doctor and not be an ER doctor for the next 3 to 4 years. So it's there's opportunities and there's risks as well.
Yes, thanks. Um, so you brought up, it's kind of civilian sponsored versus civilian deferred, and I think that was a confusing thing for everybody. Um, and so, especially if we've got some MS3s who maybe haven't had a chance to really dive into that one, or MS2s even. What's the difference, like, for payback? What's the difference in my pay that I get while I'm a resident? How does that play out?
Yeah, so I've seen just about all of them. I was a civilian deferred TY year. I was active duty military for residency, and I was civilian sponsored for my fellowship in toxicology. And when you're in deferred status, you're basically inactive reserve, and you are not active duty. You're not accruing time. You get no pay. You get no benefits. You are a civilian, kind of like in medical school, although they're not even paying you a stipend in that regard. If you're an active duty billet, you owe your time back 1 for 1 for your years of residency, but it's paid back concurrently with your time in medical school. And then if you're civilian sponsored, oftentimes that's a non-concurrent payback. So you owe your medical school time and you owe your time for your residency as well. Although there are nuances to that I will not speak completely to, and don't hold me to that 100%. I don't know the payback for OEM exactly, if that is a non-concurrent or concurrent payback off the top of my head. But if you're active duty, you get paid a salary of a captain. Because you're a captain, you get all health benefits. You do have to show up to your urine drug screens. You do have to show up to your PHAs, your physical fitness tests every year. And so you're active duty with all the requirements of that. If you're in a deferred spot, none of that applies at all.
And so, to be maybe extra clear, if I go to Dr. Sungar's residency, am I civilian sponsored, or am I in an active duty slot, like a traditional active duty slot? I.e., is my payback? I know I'm getting paid the same, but is my payback different if I go to Denver Health or UT San Antonio or some of these other programs?
My understanding is that an active duty, our program is an active duty spot, so your payback's the same as if you go to any of the other active duty locations. I will say that all of my non-military residents are jealous of the Air Force salary and benefits. Our benefits pretty good at Denver Health, but not quite as good as your all's.
Yeah, the BAH goes pretty far in Denver. Or, well, it may not go far in Denver. I imagine it's a big number in Denver. Dr. Roth?
Yeah, I was going to say that's accurate. So anything that's listed as an active duty slot on the HPERB is that it's an active duty spot, even if it's you and 17 non-military residents in your class. You don't owe any additional time for that, so you're still on active duty.
So I guess that begs a question: how many people will get will be offered a deferred or civilian sponsored spots for residency?
I think in the past that has kind of depended on how many applicants we have, how many civilian deferred spots were offered, and then kind of where, if there are more Air Force spots than applicants, and maybe not every candidate we feel is somebody that would be successful in emergency medicine, we do not have to fill every single one of those spots. But it all kind of depends on how many applicants there are. And historically, the stronger applicants, I feel like, have gone to the active duty programs. But Brian, I don't know if you want to speak to that as well.
I would say historically, the active duty spots take the stronger candidates historically. It changed a little bit year to year depending on how many OEM spots there are, but definitely, if you want to do civilian sponsored or civilian deferred, and that doesn't include the active duty spots that are civilian centers, then we definitely want to fill the active duty spots first, and we're going to take the best candidates into those spots. Of course, we do take individual situations into account. If you have a compelling reason for wanting to stay in a certain locale that we don't have a spot at, but yeah, the active duty spots have to fill.
And for our students, by all means, if you have questions, feel free to either put them in the chat, like Adam just did, or if you want to kind of keep it confidential or anonymous, you can send that chat just directly to me. I'm not in the Air Force and I don't sit on the board, so I won't affect your application whatsoever. Or if you just want to ask out loud, we can do that too. But do you guys have any questions?
Thanks, gentlemen, for answering all these questions. Unfortunately, I have another obligation, but appreciate your time.
Okay, thanks. So let's say my spouse is in med school with me, and she's in the Army, or well, let's do Navy because that's, I feel like, less an easy answer. What are our best options for like applying to medical school or applying to residencies and trying to be close to each other? Like, how do we do that if we're dual military?
Branch transfer? No, several. A lot of my med school classmates ended up who got married who were in different services did end up doing that. Just because outside of San Antonio, Walter Reed, there aren't a ton of joint programs, especially Air Force and Navy, and with the exception of certain specialties, uh, Portsmouth and OBGYN, but specifically for emergency medicine, if your spouse is Navy, Vegas is about a 4 hour drive from Southern California. And then, I guess there's a Navy spot this year at SAMC. So
Now, what if my spouse is applying to civilian programs, maybe not emergency medicine? What can I do? What should I advise my spouse to do when applying?
I think we've had this scenario a couple of times. I think it's advantageous to be upfront with the program directors when you're interviewing. There's an advantage to have one person kind of go first, and the spouse who is not in the military kind of knows what the options are as far as location for their military spouse. So they can kind of start looking more closely at residency programs in those cities and try to line up some interviews, and then wherever that person feels like they have the strongest chance of matching, maybe prioritize those sites and interviews. But it's not easy because it's not like a simple couples match application like if you had civilian and civilian. So it's a little more nuanced, but we try to take that stuff into consideration for sure.
Yeah. I'll throw in that when I was at Fort Hood as faculty there, we did have kind of nearby civilian institutions. We had two of them. We had relationships with them. And so we had a couple of instances where we knew that, one of our residents or one of our students that we were hoping to match, his spouse was going to OBGYN, and we kind of leaned on our partner institutions like, hey, you should really consider this person, seriously. I think they're going to consider you seriously. There's a reason there. So you might ask, you never know what relationships might already exist. But I think it's potentially worthwhile doing. Carrie asked in the chat, for the civilian paired institutions, would it be recommended to apply both through mods and RCAS to these programs? What's the guidance on that?
If you really want to go to the program, I would apply it to both. Because if you don't get in the military and you get a civilian sponsored or civilian deferred spot, then you can continue through the CAS. And if you really want to go there, then we have several people at Wright-Patterson that either got deferred or sponsored spots and end up at Wright-Patterson who did not get into the military match.
We've had that scenario several times in the past. I think most recently, 2 years ago, we had somebody in that situation. So, and to answer the other question, they're not going to be listed by name on the HPERB if they're civilian sponsored. So, any of the programs that are listed by name on there are active duty Air Force spots, and then civilian sponsored is just going to be civilian sponsored.
Yeah. So if you go through the match, and if there are more people trying to train than there are active duty spots, you may receive a civilian defer. Hey, go be a civilian and find your own place, get paid by that hospital, or you're offered a civilian sponsored position, which is, we're going to pay you. You still have to go find your own place, but we're going to pay you while you're doing it. However, you owe a longer obligation. Please correct me if that's wrong. Program director types. I'm pretty sure that's right. Okay, cool. Somebody posed this question to me, and for our programs, how do you view applicants who did not have the opportunity to rotate with you? If they're maybe only able to interview or maybe able to like do 1 or 2 shadow shifts, like, do you still match people who don't rotate?
I'm happy to chime in. It's going to be specific to each individual program. And so I think it's helpful, particularly for those programs that are high on your list, to reach out and to ask about expectations. But, we get, I don't know, 1,400 applications for our civilian spots each year, and we have about 50 rotators each year. So we are very used to reviewing applications from people who did not rotate with us, and it has no impact on kind of how we evaluate any of our candidates, military or non-military. I think the big downside is the opportunity to see the program for the applicants, to understand, is this where I want to be? Is this where I want to train? Do I get along with these faculty? Do I get along with these residents? Is this a place where I could be happy? And I think there are other ways to get that experience. I don't think you have to be in the emergency department to see that. And so whether that's making some time to get to those cities, whether it's reaching out, virtually to residents, faculty, et cetera, or a lot of programs are doing these kind of second look opportunities later in the year. But I think a lot of what has been said today is being proactive and asking for what you need. So, we're all busy program directors, and we recognize that these are huge decisions that y'all are making. So shoot us an email. It might take a couple days to get a response, but we want to help partner with you to find you the best place where you're going to be happy and where you're going to succeed.
And I would say for us, our civilian side, I mean, it's very common to not have people rotate with us that we're looking at, and we absolutely evaluate the application as a whole. I'd say in the military side, it's more rare that people are going to rank us high who haven't rotated with us. We will definitely look at a full application, and if you have an excellent application and you rank us high, that's wonderful. And you're definitely gonna get a good look. But just in my experience, people who don't rotate at Wright-Patterson typically are not ranking us all that high.
Yeah, we found that to be the case as well. 5 out of 6 of our incoming interns rotated with us last year. We had one that didn't. But you're never going to be in the wrong, especially when there's only a handful of military programs. We understand through the civilian match, if you're applying to 15 programs, that you're not going to physically get out to each one of them. But we did have several applicants come to Vegas to do in-person interviews, and we'll have social events and everything the night beforehand. So that's definitely appreciated, the effort and the interest. Even if you're not able to get in for an active duty rotation, it doesn't work out for whatever reason, we're still happy to have you in any capacity. So
You said 5 out of 6, which really means 16% of your people didn't rotate there. So that's, glass half full.
Good
way to
math
look
there.
at it.
Hey, and just one quick thing, I have to get going, but anybody who wants to reach out to me, please do. And I'm happy to answer more questions. And I hope this was super useful for everybody.
Thanks so much for joining, Dr. Murray. Good to see you as always.
Take care.
If I ask for an interview, even if I don't rotate, will I get one if I'm active duty?
Usually. It's tough for us because we have interviews that start in, I think our first one is July 23rd. And then we interview, and there's kind of a blend there in the October timeframe where we start to do half military and half civilian in our interviews. So we do have a somewhat limited number of spots once we kind of have to start giving up those interview spots to civilian folks. But we usually have 10 spots each of our interview days, and we do at least 2 per month. So I don't think last year we had to deny anyone an interview. We can usually find a spot for you.
Dr. Sungar?
Yeah, we are, I think, similar answer. Our constraints are a little bit more. So I would say we had probably 2/3 of the folks who reached out for interview requests last year got an interview with us. We do ask some additional questions with that interview request form, which is just kind of some basic data that helps us to better understand if you're going to be a good fit in our program. And my understanding is that that's not super common with some of the other programs, so we're a little bit unique in that regard. We similarly start interviews late July. We'll wrap up all of our Air Force active duty interviews by end of August before we jump into the civilian cycle.
At BAMC, our interviews already started over the last few weeks. We kind of have them throughout the summer, and we also fit about 10 to 12 interviewees. Last year, we didn't have to turn anybody away, and I think as long as you just get in early enough, we'll slot you. Depending on how early you reach out to us, though, you may be booked out quite a ways because they do fill up pretty quickly. So,
and I recall from my time in faculty, I think we only turned down one interview request ever, and it was just glaring academic issues. I think most programs, at least most active duty programs that have more than only one or two spots, they might be willing to tolerate someone who's got less than stellar numbers if you end up being a very teachable, good human being, and they won't know that if they don't interview you or don't see you on shift. So, sort of in that same vein, is it recommended for students to request an interview at all of the sites? Should they be trying to?
Not going to hurt if you have the time. There's only 6 active duty programs. I don't see why you wouldn't request an interview at all the sites. And in fact, we do communicate with each other to make sure that nobody kind of gets lost. And we'll share who all is scheduled for an interview with us and share with the other program directors. So that way we can be certain that if, for whatever reason, somebody didn't know that one of the programs existed, that we can reach out to them and say, hey, notice you weren't interviewing with us. Is this deliberate for reason? And if you got good reasons, great. But we just want to make sure that nobody doesn't have the opportunity that wants to interview with us. So I would say yes.
Thanks so much. Any other questions from the group? Or can you still rank programs that you didn't interview with? You can do whatever you want.
You can. I don't know how that's going to go. That would be tough.
Yeah, because at that point they're going to be reviewing an incomplete packet. So if you rank them, they're going to get your packet through mods, and they're going to be able to see your letters of rec. They're going to see your letters, see your school letter and your grades and your scores, or at least your score. But if they have no interview to base it off of, it might be tough.
Right.
I will say everybody at BAMC for the incoming class did interview with us last year, but not everybody who's in the incoming class actually rotated with us. So there's 2 people that didn't, but definitely get the interview. I would agree with Dr. Roth. Definitely, shoot your shot, at least book an interview if you can't actually go out there and rotate with these programs.
Victoria?
Hi, I hope everyone's having a good evening. I had an additional question about the OGME spots. Looking back at the HPERB, they're not listed as civilian sponsored. However, looking at the information on ERAs for Air Force residency programs for emergency med, they are noted as sponsored. So I'm very confused about those. Is there a good resource that I could reach out and ask that question to?
Yeah, so Jason Frisch is the guy that's in charge of that program, and he's also got a flight medicine slash residency aerospace medicine guy trained that is his kind of second in command for that. None of those OGME spots are sponsored, so I don't believe you're going to owe additional time for those. They are all at civilian programs, so it's a little bit different. There's ones at Einstein and Ohio State, kind of all over the place. But going the OGME route, the only difference in training really in outcome. I mean, you're still training in emergency medicine, but instead of kind of being assigned to the instead of being assigned to the emergency medicine consultant to the Surgeon General in regards to assignments and potential placements, you are assigned to the flight medicine consultant. And that kind of will dictate what kind of jobs you're going to be able to get after graduation. So, but yeah, Jason Frisch and these folks are all at Right Pat. And I can get you the email contact, but he's the POC because a lot of the program directors at these civilian sites don't know much about the Air Force, which is reasonable. So he's kind of the point of contact for all of the active duty questions about that. But to my understanding, for the OGME spots, they're not a time commitment like a civilian sponsored spot would be. I don't know why they're listed that way. That's kind of weird. So
Thank you.
let me get Jason's email for you.
I see it there in the chat. Thank you,
There's a
sir.
tiny chance that that's wrong. That was his email a year ago. I don't know if he's at health.mil or if he's
Yeah.
right.
Let me check.
You might have it right. Okay. So question that was posed to me that I don't know the answer to because I'm still not in the Air Force. But as far as the 8 civilian sponsored spots on the HPERB, where are they? Where are the other civilian sponsored spots? We know the full list.
What do you mean? What do you mean by that? Like, where are they physically located? Oh, um, so that's not really a where are they physically located. Basically, what happens is in December on match day, you will be informed that you either matched into one of the active duty residencies, or you will get something that says you have matched civilian deferred and or civilian sponsored. And at that time, your application essentially, it's the military says as long as you get accepted to an EM program anywhere, we're going to have you go to one. So your application at that point essentially turns civilian. So it goes to the residency caste system now. And then you'll do kind of the same process. The tough part is it's a little late in the game. So if you've got interviews scheduled and everything, most of them are kind of more mid-December. And again, some people get the deferred spots and then still match at a program that has active duty spots, like it's happened here and Right Pat. But there is no physical location that you must go to if you get a civilian deferred or a sponsored spot. It's the military giving you permission to go train at a civilian program.
So I know that for fellowship, so I did a civilian sponsored fellowship. I was highly employable because I came with my own
Yeah.
money, and
Right.
the program just had to maybe ask for a compliment increase from the ACGME, or maybe not. Is the same true for residency? Are these like civilian sponsored? Just are there programs just salivating over the idea of a free resident?
You you have to apply for an expansion if you're going to do that, or it takes up one of the spots. But there's typically not a downside for those programs. So maybe it helps, but again, if you're not an applicant they feel is going to fit with the program, then they're not going to prioritize free labor. I think fellowship's a little different because a lot of Army guys that have done plastic surgery fellowships at like Harvard and Stanford and all over the place. I don't think residency is the exact same way, but it's certainly not going to hurt. But in that same vein, you may get to train in one of those places, but you're gonna owe additional time if that's something that you're not wanting to incur.
And I could be wrong, but I'm not aware that programs know that you're civilian sponsored when you're going, like once you're put back into the civilian pool. We always interview a ton of military folks across all the branches outside of the active duty Air Force position, and we have matched people before that were civilian sponsored, and it was kind of a nice treat in April once we realized we didn't have to pay for them.
Thanks. And to provide some timeline, and again, correct me if I'm wrong, you're going to complete your application for military residencies, like in mods, by October 1st or 15th, or either. Taylor, you're about to answer the question. You're going to find out in mid-December whether you're going to an active duty spot or if you're getting one of these civilian sponsored or civilian deferred. Meanwhile, these civilian residencies who are just civilian residencies or civilian residencies who happen to also have some Air Force spots, they're well into their interview season already. So if you haven't gotten your application out there, if they don't know that you exist, it's going to be really hard to suddenly enter that pool late. Not impossible, but it may be much more challenging. So you don't know if the Air Force is going to give you one of these civilian sponsored or civilian deferred positions until mid-December. But then you're really kind of having to catch up if you're still looking for a spot. That makes sense?
Yeah, and you're kind of late in the game, so it's never if you're going to apply, I would encourage you to apply to both. If there are civilian spots, why not increase your chances of matching? But if you do schedule interviews, not a bad idea to make the vast majority of them after the military match so that you're not wasting your time and money and you're not wasting that civilian program's time and money. Because, if you interview with 10 programs and then you have to call each of them and say, oh, sorry, I matched at a civilian program, you've kind of just taken a spot that maybe somebody else could have been in. So
Thanks. All right. Any other questions out there?
Along the same vein of OGME, can you speak to residents coming out of the residency programs that looking to do more operational Air Force EM jobs, and can they go do that from the partnered and traditional residency programs?
Yeah, so that's a good question. Depends on what you want to do. If you have interest in special operations surgical team or JMU or some of these other specialty, more like operational surgical team type stuff, you will not be able to do that in a flight medicine billet. So if that's something you're interested in, the OGME spots, most of the time they'll tell you that they're going to try to get you into we'll call it a cool guy job, so with like a rescue squadron or a special tactics squadron or something like that, to where you can actually use your EM skills to help teach and train pararescue guys and other operators on emergency medicine techniques and TCCC and all that stuff. I will tell you there are probably more OGME grads than cool guy jobs coming up for grabs every year. So I don't know what percentage of people that graduate from OGME residency programs match into their first, second, or third choice in specific job and location, because a lot of that is going to depend on who's leaving where, what year, because most of these are 3 to 4 year assignments. So if the guy at the 22nd Special Tactics Squadron isn't leaving the year you graduate, you're not getting that job. So there's a little bit of luck involved and chance, and probably some good questions for Dr. Frisch also.
Yes, sir. Thank you.
What other questions are out there? All right, seeing none, do our panelists have any kind of final closing thoughts? Dr. Roth?
No closing thoughts. I think most of our rotators are scheduled. We still have some couple of stragglers reaching out for interviews and stuff. So more than welcome. We can try to fit you in where we can. But that EM Nellis clerkship, let me just I think that was accidentally direct messaged to Adam. There's an email address basically that goes to our clerkship coordinator, and so you can give you more information about availability for interviews and stuff. So
thanks. Dr. Espinoza?
Closing thoughts. Just some of the observations I've made with medical students so far this season. when I have feedback sessions with them, there's been unfortunately one individual who did kind of badmouth another program. Don't do that. That's not a good look. Just don't do that. We're all, we all know each other. Some of us have trained at some of these programs that you're talking about and, have a heart for these programs. So, wherever you go, it's going to be amazing training, and you're in good hands and you're going to be with great people. Just don't do that. Another thing too, that I've noticed on shift, sometimes I'll have two med studs with me and I'll ask a question of one med stud, another med stud chimes in with the wrong answer, and it kind of happens repeatedly. Play well in the sandbox, let your counterpart answer a question as well. These things are noticed, not just by myself, but like other attendings who are working, current residents who will be your future colleagues. So just keep all this in mind when you're rotating.
And combining your thoughts of playing nice with your other med students and not bad-mouthing other people. Don't badmouth other med students. Not your job to evaluate them. You're
Absolutely.
look out for yourself. Be a good team player. Dr. Sungar, any closing thoughts?
I threw our interview request form and my email in the chat, so please feel free to reach out to me with any questions. I always reflect on this time. This is obviously a nerve-wracking experience for you all as applicants. And there's no way you'll believe me when I tell you this, but in 6 short months, for those of you who are applying this year, it's going to work out and you're going to end up in the right place. And you can't go wrong with any of these programs. So take a deep breath and try to remind yourself in that in those times where the stress is boiling up. But we're here as a resource. Reach out if we can be of help.
Thanks so much. And thank you to all of our panelists for being here. Really appreciate you taking an hour and a half out of your evenings. Actually, a little more because I asked you to be there early. And to all of our medical students, thank you so much for joining as well. And again, this is hosted by the Uniformed Services chapter of AAEM. Free to join if you're already in the RSA. So feel free to just add that chapter membership on. And I really appreciate everyone being here.
The Army breakout room. I am recording this just so everyone knows, and I think it'll give you that warning. I know that we've had a lot of very good conversation already. What I would like to do to start this breakout room is just to have each program that's here, and I'll kind of call you out, introduce your program, try to be brief so that we can allow more time for students. And to allow more Army specific questions. So Brooke Army Medical Center, can you start? I don't know if that's going to be you, Dr. April, or Dr. Frawley, or Dr. Chen. Just one of y'all give me a quick introduction to your program.
Yeah, sure. I'll take it. So Brooke Army Medical Center, it's the flagship hospital, but the GME umbrella under which it rests is the San Antonio Uniformed Health Education Consortium. So if that SAUSHEC term gets confusing, it is the same program. It is a joint program. The current class size is 17 per year for a complement of 51 total over the 3 years. That is currently divided over 8 Army, 8 Air Force, and 1 Navy. As far as I am perceiving at this point in time, I think that breakdown is going to sustain over the next couple of years. So we are a fully joint program. In terms of distinguishing features, there's a lot to say. I think for us, we are privileged to be co-located with the home of military medicine. That gives us access to a unique complement of resources and individuals such as consultants to the services. And what we're striving to do is leverage those resources to make sure that we're simultaneously giving an excellent clinical education while also equipping our graduates for tactical excellence when they graduate. So to really practice as effective, Army physicians as opposed to just physicians in the Army.
Thank you, Dr. April. Dr. Phelps, do you want to go next?
Sure. So I'm Jillian Phelps. I'm the program director up at Madigan. Madigan is located next to Tacoma, Washington, which is about 60 minutes south of Seattle and about 2 hours north of Portland, depending on traffic. We're located in the beautiful Pacific Northwest. It's a balmy 75 degrees and sunny right now, as opposed to the hundreds plus that you guys may be experiencing down in Texas. We're a level 2 trauma center. It's a moderate sized academic facility. We have 14 ACGME programs and 11 non-ACGME programs. So your IPAP support programs, your social work, your nutrition and things like that are here as well. We are a large post. We're a division size element with a core headquarters, which means that we have a lot of conventional force comm units, as well as a lot of support brigades like military, police, the MPs and stuff like that, along with the 62nd Med Brigade. And then we also have special forces. So we have Home of the Rangers, 2nd Battalion here. We have the 4th Battalion of the Special Operations Aviation Regiment. And then we have the 1st Special Forces Group. So we are really fortunate because while we don't have Medco, we do have a lot of training across this post that we get to nest ourselves in, because most of our faculty are actually borrowed manpower from the organic units. So we're fortunate to have emergency medicine nested throughout both special operations, conventional units, as well as the Med Brigade. So a lot of training opportunities come up, and we can actually bring our expertise into the residency program from the faculty that participate, or sometimes even allow our residents to participate as well. Our rotation clerkship director is Simeon Ashworth. He's on shift at the moment, so he couldn't pop on. And then Cindy Kirker is our residency coordinator. Those are the 2 best points of contact. And then we're going to start publishing our chief resident, who's in charge of our recruitment season, shortly. But it's Sean Egan for this year. Thanks.
Thank you, Dr. Phelps. Dr. Parker, do you want to talk about your program, and then I'll cover any programs that aren't here, plus Darnell.
Sure. So I'm Brian Parker. I'm the Associate Program Director at UT Health San Antonio. So we are the county hospital for the 7th largest city in the country. We're also about 5 miles away from SAMC. We take 1 active duty Army, 1 active duty Air Force every year. We have a total now of 39 residents, most of which are civilians. And then you rotate through our level 1 peds, adult traumas, everything available to us. We do have recent retired Dr. NG, who mentors all of our active duty residents to make sure that they're not missing out on any of the military aspects of residency.
Awesome. Thank you, Dr. Parker. So I'll talk about a couple of our programs that aren't here. I don't think MCG or Augusta is here, but they are our shared program that's civilian and military in Augusta, Georgia. And they have half military applicants that apply through the military match, and then half through the civilian match. They're a level 1 trauma center, very busy, and they rotate at 3 main sites. And obviously, when we have a couple of these nights, and then the AOA night that's maybe later in the year run through USHIS, can have some more questions that can be answered about that program. We also have another civilian site in Miami at Jackson Memorial that is a military site that you apply through for mods. And there's 1 of those positions. And that's something that we've kind of expanded on a little bit. And then last but not least is my program, which I absolutely love, Darnell Army Medical Center. It's a level 3 trauma center at Fort Hood, Texas. It used to be Fort Cavazos a week ago. It was Fort Hood 3 years ago. We're going to keep changing names because we want to keep you on your toes. And we like spending money on signs. But our program is a 10-a-year program. We are a 3-year program as of right now, like all the Army programs. We have a real focus on kind of the warfighter. We're a very busy active duty post. There's about 50,000 active duty troops at Fort Hood, Texas. We have 3rd Armored Corps, the 1st Cav Division, and then a bunch of other different disparate units, all focused on fighting. Plus, we're a major deployment location. So part of our education is how to kind of manage working in a level 3, more community hospital. We have 3 GME programs in the hospital, 2 fellowship programs. There's a total of 23 total educational programs, but only a few physician level programs in our hospital. We do a bunch of rotations around Central Texas to create some diversity in patient care, patient acuity, and patient complexity. We have a big focus on military medicine education in our program and our military unique criteria, our curriculum. We have the GYMX, or the Joint Emergency Medicine exercise that we run every year in June. And a lot of programs from the Army, Navy, and the Air Force come and play with us, where we set up, role 1, role 2, role 3, bring in a bunch of different units from both conventional forces and special forces to really build a very high fidelity, cadaver-based and simulation-based exercise to really inundate our students with a lot of stress and a lot of military education in a short period of time. And it's very well received. Our program is also really good at preparing people for the boards. Over half of our residents every year, somewhere between 17 and 23 of them, score above the 90th percentile on their in-training exams. So we do a pretty good job of teaching them the basics of emergency medicine and then forcing them to use it out in the field. I'm also the deputy consultant for emergency medicine. I know Dr. Chen's here for a little bit as our consultant. So if there's any consultant level questions, which is, our job is to try to manage the entire population of emergency physicians across the force. I'm happy to answer those if Dr. Chen moves. Did I leave out any programs? Did anyone sign in after we started talking? If not, I would love, if there's any questions to start, please raise your hand. I'll recognize you, or put it in the chat. And if there's nothing, I have some questions that we can go through.
Yeah, okay, so I gotta go through the on Monday.
So, Dr. Phelps, if I can give you kind of the first question, what are your thoughts on students that don't have the ability to rotate at your program on either ADT or non-ADT? And do you have any recommendations on how many military programs residents should, or excuse me, prospective residents should apply to? Oh, and there's a question in the chat. I'll get to that after this. Thank you.
So I'm pretty sensitive to the fact that it can be quite expensive to try and rotate. And I went to USIS, so I don't have quite the HPSP perspective. I was fortunate because I got to rotate a lot of different places. But I do understand restrictions when it comes to not only your home institution sometimes doesn't allow the rotations. You can only pick one, and you put your money in Texas because there's 2 programs there, or you think it's a lot cheaper to go on your own dime to Texas versus Georgia. I understand Pacific Northwest is kind of expensive because we're isolated when it comes to the rest of the military education system. So to me, it's more of how did you rotate at the other hospitals? How did Dr. Matlock, Dr. April, Dr. Mitchell, how did they perceive you as a team player and as a good fit? I do think it's important that if you are not going to rotate at our hospital, to engage with our chief resident and engage with our clerkship director to get a really good understanding of our program, because we are different. We each have our own little kind of niches. And I don't want you to blindly accept the truth that you've heard from other residents and other rotating medical students, because everybody has different priorities and their biases may be feeding your decision, even if you're not really aware of that. I do encourage everybody to interview everywhere. I have ranked people who didn't rotate here and who've only done a virtual interview very highly in my rank list, just based off of how professional they were, how they reached out, how much they actually knew about the program before we even talked with them. It showed a lot of depth of or a maturity of trying to figure out what actually met the goal for in a program, and more than happy to discuss further what would make a good fit for us or not. I do think our program tends to shine more in person than on paper, but I think all of us feel that way about our program. So
thank you, Dr. Phelps. I see the hand, but we'll answer the chat. Aman Patel asked, in addition to ADT rotations and slows, what are some aspects of the application that we personally place high value on when evaluating applicants? Dr. Riddle, do you want to take that question?
Yes, sorry, I was answering another question in the chat. I think, a lot of times in these chat sessions, it's very focused on what can I do, right, to optimize my chances. And I think that's very good. But I think it's important for you all to hear us say that in general, most of the students who apply will match to their first choice specialty and probably their first or second choice location. And so when you're on rotation, work hard, but like make sure that you're focusing some on yourself as well. Like, is this the type of place that I want to be? Are these the teammates that I want to have? When I look at the senior residents, do these senior residents look like what I want to look like in a few years? Do I want to focus on a program that does a lot of rotations at one site, or do I want to would I prefer visiting multiple sites? Some people want one way, some people want the other. So I think it's kind of the opposite of the red flags in my mind when I think about red flags. If I can expound on this question a little bit, I think about it in different formats. I think about it like academic red flags, professionalism red flags, and somewhat like military specific red flags. And so if you are somebody who is coming to shift on time, eager to see patients, you're a team player, there's no feelings that you have signs of arrogance or aloofness. I think that is going to be the biggest aspect, at least in my perspective, of your application outside of your rotation evaluation and your slows. And I think they feed into one another. If you come and you work hard and you're engaged and you're a good team player, and that feeds into your slow and your rotation evaluation. So it's hard to tease those out one from the other. I would say I don't know that any of the programs specifically say, well, this person has 20 publications, and so even though they weren't great on shift, we're going to leapfrog them over all these other people. That'd be my perspective, at least. I think every program generally is trying to, for lack of a better term, build a baseball team. So it'd be nice to have somebody who has some research, somebody who has some life experience, somebody who's an academic all-star, somebody who's a real team player that brings everybody else together. And if you can imagine, like, where do you fit in that role? And then I will turn it over to Dr. Phelps.
Go ahead, Dr. Phelps.
I agree very wholeheartedly on that. I think instead of trying to build this like huge packet where you're doing like 15 publications and you're sitting on this chairing this committee and then you're doing this and then you're doing this, like, I mean, you can really burn yourself out by doing that. And then it makes me worried that you're not being a complete person outside of shift. And the longevity of emergency medicine is learning how to be a person and a physician and a military officer all at the same time. And so I don't want you to burn yourself out in medical school, because you're just going to tank residency and then you're going to have no capacity. So I know that some of the applicants will be like, I have like 7 emergency medicine rotations and I'm going to be great at this. A lot of emergency medicine is knowing the key elements of the different specialties and when to call that specialist and when this can actually go home and follow up with a specialist later, and knowing the ins and outs of what it means to admit somebody to the hospital who is having social challenges and needs like help with the social workers and case managers and things like that. So I think fully engaging in your non-emergency medicine rotations, it reads like we can read that in both like the shift evaluations from outside places and things like that, but it also brings a different curiosity when you're consulting your consultant colleagues. When you're on shift with us, it shows a little bit more humility and growth mindset and willingness to take care of the patient safely, as opposed to just being right and knowing the right diagnosis and the right answer. We are a larger system where we're calling a lot of residents for help. And I can teach you medicine, but I can't teach you necessarily conflict resolution when you're only out to be right, as opposed to what is the safest thing and the best thing with goal directed care for the patient.
Awesome. Thank you. Kyle Rudolph, you have a question?
Yeah, hi. So this is probably not going to be applicable to everybody, but I know it's applicable to at least a couple people in this room. So, hi, my name is Kyle. I am in the less than optimal position of being a TY who is applying for emergency medicine this cycle going around. So, question for us, because I know there's a couple other interns in this chat as well. As far as like the slows go, because we only have like one EM rotation with the way our intern schedule is set up. How is that gonna like work for us in the ballpark of getting like these additional LORs that we need to get for the application cycle this year? Like, do we just need to take whatever we can get on the on our rotations leading up to it, or I'm not sure how that's gonna work. And then also for like away rotations for us, because obviously we can't leave.
Yeah, those are some great questions. Can I get Dr. Farley or Dr. April from BAMC to try to address those?
Yeah, I'll start, and then if Dr. Farley has anything to add. But one of the recurring themes I hope you're getting out of some of these responses is we strive to be reasonable human beings. I mean, we understand what is within the realm of possible, what is not. All that we ask is that we have ongoing dialogue, transparency, and discussion about why your situation is what it is. And I think being a TY intern is a pretty good reason for only having one slow. The other piece I would add in there is this might be an instance where if you feel like you have other individuals who would be in a position to provide a recommendation for you, perhaps just LOR that's not in the slow format would be advisable. So I wouldn't get too spun up over not being able to get multiple slows. But Dr. Frawley, you have anything further on that?
No, I think I think we can see what your last year was, that you weren't doing 4 EM rotations or 3 EM rotations, so we know that you're not going to have those. I think the other thing I would say is just to go back to your initial lead into your question of I don't know that any of the programs necessarily sees that the TY is a unenviable position to apply from. I think that there are there are certainly folks that have come out of TY programs in all of our residency programs that have performed at the top of their class. They just either needed that extra year to decide what they were going to do. Could a TY year be detrimental? I think if you see it as a year, if you see it not as a year to excel clinically or not to learn all you can from all the specialties that you're going to rotate through, if you're blowing things off because I'm not gonna be doing this, I'm not gonna be a general surgery resident next year, I can certainly see how it could be detrimental from that standpoint. But I also think that we've had folks that said, you know what, I just need that extra year to decide what I want to do, or whatever the reason is, and have come out of the transitional year program and really excelled. So I Mike can take the technical aspect. I think from a just mindset, I really think that can be a benefit too. You get a lot of people in different hospitals, kind of even in your core, that talk to the program directors. It's not like each of these program directors lives in a vacuum within the hospital or is isolated and doesn't talk to everybody else that we work with every day.
Thank you both for that. There's kind of 2 things in the chat that I wanted to try to address. One was about the dual military match. I think overall, this is pretty straightforward. If you're applying for dual military, you're both active duty Army, and you're applying for different specialties, your packet in mods is coded separately, and the panel pays attention to that. And so one of you applying for OB and one for EM, or one applying for anesthesia and one applying for EM, it significantly narrows down where you can both match. And the Army is interested in keeping families together to some degree. This is an official program that they're going to look at and see what is possible. It's often going to limit your choices significantly, but just be open and honest. I would still interview at every program. I would still put your name out there and make sure that you're applying to all the programs. But we have at least one applicant every year that falls into this category. And so we've handled it before, and I guarantee we will handle it, because it goes back to what Dr. April said. We are humans, and we try to treat people with respect and try to kind of take care of them. The second question ties into talking about student or deferments to civilian. And so words here can get kind of fuzzy, and the Army cares about words. So the Army does not do civilian deferment. And deferment is, if you hear from an Air Force person, deferment means that we send you out to the civilian side, you're paid by the civilian program, you're not on active duty, and then you come back trained. The Army does something called civilian sponsored, and it is part of our broad school year plan. So we kind of do a bunch of paperwork and we program how many slots we're going to have at each program. And each program can tell you what those slots are. And often we're breaking them down into a certain number of medical students we're going to pull out of the match and a certain number of field candidates. And the field candidates are TYs or GMOs, or someone who's done another residency and is applying to a second residency in EM. We will not commonly, and I would say that in my experience, we have not done this in over a decade, send someone out as a deferment. What we will do is we program some funding to send people out for civilian training. It's civilian sponsored. You're active duty, you're paid by the military, paid by the Army, and then you go on to apply. Those numbers change, but what Dr. Phelps said in the chat, anywhere from 1 to 4, maybe a little more, because we value emergency medicine, that's part of it. Is there any one of our programs or anyone that wants to clarify that question to add on to that?
It just needs to be said that because it's a sponsored position, not a deferral position, there is an additional add. So you go from whatever your current add so is, if it's 4 years for a 4-year scholarship, it then adds 3 years to that. So if you take a civilian sponsored, you're going out there, the Army's paying you the entire time, and therefore you're accruing a year for a year of training. So if you take a civilian sponsored, but it does open up amazing opportunities having the funding from the military. A lot of programs look on that very positively, and you can train maybe in a very specific area or at a very specific program because you come with funding, which is an enviable position. Just to recognize it does add time to your commitment.
Awesome. Thank you, Dr. Riddle. Another question in the chat was they were curious as to what we as faculty want the students to take away from our program. Dr. Phelps, do you want to take that one to start?
I apologize. Can you restate the question one more time?
Yeah, absolutely. I know you had to drop off, so I wanted to get your involved in this one before you got to go. What do you hope from the faculty perspective that the students will take away from rotating at your program?
Sorry about that. So, I mean, really what I hope that rotators come to our program and kind of take away from this is one, a little bit of the military culture, a little bit of what the expectations are of them, but really just each of the different programs are excellent programs. We're all nationally ranked. Like they stopped ranking us actually because of how well we do on our in-service training exams. We're exemplary programs and have a lot of amazing attributes. We all have little niches, and there's a lot to the different programs that we can add. And so for me, it's more of just a culture of respect. There's a very high expectation that not everybody's going to love my program, but I still would like them to appreciate what we can offer, even if they elect to go to a different program that would more suit their needs if they really want the high volume, high acuity all the time kind of program. That's not us. And I think there are nuances and there are still ways to appreciate your peers because it really is a small family. And so if I think that somebody walks into our program and they think that they're earning accolades by bad mouthing BAMC or MCG, they're actually doing a disservice to themselves because they're not seeing the positive aspects of the different programs and what they can contribute to the Army message and the military power. So like, I actually really, I know that sometimes they're trying to ingratiate themselves to me, but it's been distasteful sometimes because those are my friends, those are my colleagues. Dr. Matlock and I trained together. Dr. Frowley and I trained together. Like these are my peers and I respect what they do very, very deeply. Even if we just have different approaches to the same problem set. Does that help?
Yes, thank you, Dr. Phelps. Any one of our programs want to add on to that answer?
I mean, I would just foot stomp my earlier comments about how I hope that a big piece of what every student gets out of every rotation is a greater appreciation for the environment, for the people, for the relationships. You can read a lot of statistics about each of our programs. We have pamphlets, there's plenty on the internet, but I can't recreate the people, which is really going to be the most important piece. And I think that should be and will be what drives most of your decisions about where you end up, and appropriately so. There are many, many ways to train excellent emergency physicians, and I'm supremely confident you all will become one regardless of where you go. So let's figure out who your people are.
Great. Thank you, Dr. April. There was a question in the chat about those who have prior military service and how to highlight that as part of their application, and whether they should focus on clinical and academic performance during medical school. Dr. Riddle, do you have thoughts on that?
I would say that, goodness, that is surprisingly challenging for me to answer. I think that prior military service is very valuable. And I think, as I mentioned a little bit ago, I think every program in general is probably trying to build a team that is somewhat self-reliant and has its own strengths. And I would say that people with prior military service frequently come with experience, they come with maturity. They come with some understanding of how the military system works. I think those things are all very good. I will say that I think if it becomes a drum that is beat too many times, that it can potentially alienate the other students who are around you. And that then kind of bleeds into the idea of teamwork. And we're looking for people who will be able to come in and use their strengths and recognize other people's strengths and maybe focus on other people's strengths as well. So I would say we are always looking at applications and we always appreciate people who've done things in the military. It definitely has built people's CV, sometimes very impressive. At the same time, there are a lot of people who haven't had prior military service who also have very unique things. And I think the balancing of that, I think, is very reasonable to bring up, very reasonable how you can talk about in your interview how that may provide strength to your packet, to the program, and also in a humility way, recognizing that that is one aspect to an application, and there are a lot of other aspects to an application that other students might have.
Thank you,
I,
Dr.
I just have to say, it puts a huge smile on my face to see Jason Flores's name in this chat. It's great to see that you're still progressing in your training. I would just dovetail. My immediate reaction if I see prior service is that is a huge positive. So that's my default position. But to just echo Dr. Riddle's point, if it's not accompanied with growth mindset and humility, then any advantage there will quickly wash away. But you of all people, I know that.
Thank you for that. And I know there's a couple of questions about the civilian-sponsored application process. What happens if you do match civilian-sponsored versus what happens if you and then don't get a civilian spot, or if you're not interested in civilian-sponsored, what happens if you don't match military EM? Dr. April or Dr. Frawley, do you want to take that one? I know it was a convoluted question, so I can.
Yeah, I'm looking for the text to wrap my head around it.
So, if you match civilian sponsored and don't get a spot in the civilian match, what happens to you?
So generally what happens at that point, most likely, from my understanding of things, is you'll end up as a TY intern. So you'll have an opportunity to compete again the subsequent year. But I'm not aware of it being a common occurrence that there would be a scramble like you see in the civilian match where you would then go to other unfilled spots. But I am brand new. If other PDs have had different experiences, by all means, set me straight.
I've never seen someone in that position. If you get released to the civilian sector, you're coming with funding, unless you apply to like just one or two programs that are incredibly competitive, I've never seen someone not then get picked up by a civilian program. But I would completely agree with Dr. April. If you are not picked up by a civilian program, you would then be brought into a TY year.
We did have one, what was it, last year or 2 years? She had to scramble because the programs that she elected to apply to, she had not more eloquently stated that she came with funding and they denied her or something like that. And then there's a lot of us that have friends in the civilian world too, and we know the programs that are very friendly to military applicants, especially that the money. And so sometimes our people that get that civilian offer, if you reach out to us, we can help you. Like, hey, I know Yale is very friendly to the military because Dave Della Justina was my chief of the department here, and now like he's the chief of the department there. It's a pretty small community, and we can help point you in the direction of like who to kind of focus your efforts on.
I can't necessarily speak to this exclusively from an EM residency program, but I think that it applies in a similar fashion. Many programs, so I do know this experience from fellowships. Many programs are ACGME accredited for a certain number of fellows, but they are then funded for for residents, a smaller number. So just as a fellowship example, where I did fellowship, we were ACGME accredited for 12 fellows. We were funded for 8. That's over 2 years. So that means that each class could be up to 6, but the medical center only came with funding for 4. So part of, as you look around for programs, civilian programs, if that's the route you're going, if you can kind of learn the size that they have, if they are accredited for more fellows and they're residents and they're funded for, then that might be a program that you kind of emphasize because you can say, look, I know you're accredited. I come with funding. You don't have to pay me. Could you have a spot for me? It is not a guarantee that they'll give you a spot because they will also look at their patient volume, their case mix and things like that. And they don't want to dilute each individual resident's experience to say, oh yeah, we'll just take 14 people, even though we don't have the patient volume or the caseload to support that. So there is some room there usually in many big programs. It is not a guarantee.
Yes, thank you all. And the corollary to that is if you don't want to go civilian sponsored and you match out of the military match civilian sponsored, you can turn that down and elect to go TY. There is a separate, it's called a rebuttal board, but it's basically the scramble for the military match after the military match. And that allows you to either kind of turn down that civilian sponsor and request a TY, and it'll go to an alternate on the list if that exists. Or if you need to switch programs, which is rare due to a marriage or you're married to another military member or some family emergency or something that occurred, that's the opportunity to advocate for yourself. And the Army will look at it and see what is possible. Sometimes it's possible, sometimes it's not. There is a question in the chat about if we could just go back to rotations, is there any inherent disadvantage between rotating 2 weeks, 3 weeks, or 4 weeks at various sites? Does anyone want to answer that for me from one of the programs?
I mean, in general, longer better. In general, rotating in person better than remote. But I don't view any of this as a showstopper. And I think if your schedule only allows you to come for 2 weeks, that'd be great. We'd love to have you for the 2 weeks rather than not have you at all. But the other piece to this, which I think sometimes gets a little bit lost in the discussion, just because so much of the focus is on the match. But I really do take seriously our responsibility to make the clerkship an educational experience. So, to the extent that we are teaching you as future military physicians the practice of emergency medicine, we're going to do a better job in 4 weeks. But yeah, I wouldn't get too wrapped around the axle over it.
I think
Dr.
the
April, do
only
you know
other
anybody
thing,
that didn't rotate at the place that they did residency?
Yeah, Dr. Frawley's calling me out. So I am in that boat of I did not rotate where I trained. Things happen, but I stand by if I'd been recommending to me the way ahead, I probably would have said you should try to rotate to all those places. But life happens.
I think the only other thing I would consider is 4 weeks allows a little bit better idea of sustained growth. Some people can really shine for a week and then they kind of really peter out and their true self kind of starts to come out. So we prefer 4 weeks just from that perspective of like, I want to see who you are as a person for totality, not just how you think that you should behave for a week. The one other aspect for us is not my coordinator, but the medical student clerkship coordinator up at GME is for some reason very prohibitive with computer access unless you're rotating for 4 weeks. That isn't to say that you can't still rotate with us, but sometimes he won't go through the paperwork of getting you the access that you need in order to have full autonomy. So if you're only doing 2 weeks, it's a little bit more like shadowing as opposed to getting the full access. But that's not to say that we can't still try to get him to do the work or that we can't make it a worthwhile experience.
Try to answer unless we're not done with that, I can try to answer Madison's question
Go ahead,
about
Dr.
where it says if an applicant would only want to train in the Army, would it be advised to even apply to the civilian match? I will answer this because I am no longer in the Army, and I feel like I can probably say things as other people. So the letter of instruction that you will have on the mods will tell you that if you are applying to EM, you have to apply to the civilian match. And I think that it probably does benefit you to apply to the civilian match since they will reimburse you the costs of applying. So apply to some programs that you would be interested in going and then have it reimbursed and then push any interviews that you get until after the military match. That being said, you are under contract with the military, and therefore, if you only want to be in the military system, you will match to EM or to a TY. And so you will have a job the next year, whether you apply in the civilian match or not. You are instructed by OTSG to apply to the civilian match. And I will leave it at that.
This has been going on for about 90 minutes. Are there any kind of final burning questions that people need to ask? Otherwise, I'm going to kind of thank everyone for participating. I think there's been some great questions. Hopefully, we've been able to provide some insight into the military match from our perspectives and get you some ideas from the people who make the decisions. I mean, because we're the people that are building their match lists and evaluating the students. So if you have other thoughts, feel free to reach out to us. We look forward to seeing you all on rotation at some of our sites over the next couple of months. We hope you're going to be able to learn a lot from us. And, I'm very excited, to see all this interest because it's helpful for us as programs to see so many people that want to work for us and work with us and learn from us. So thank you all. Thank you to the panelists for your time and your dedication. Have a great night. Thank you.
All right, everybody, I think I got the hot potato and I'm moderating this session. I'm going to go ahead and ask everybody to introduce themselves again. And so I'm Dr. Morrison Ponce. I'm the program director at Naval Medical Center, Portsmouth.
I'm Aaron Matlock. I'm a BAMC civilian faculty. I just handed over the PD job to Mike April. I was the interim PD there for 15 months. And will be at BAMC forever. We have our first Navy intern starting right now. And so I'm here to answer any questions I can about the Navy processes, although I'll defer a lot of those, but I can speak to it as it applies to us, certainly.
And I'm Jillian Schmitz. I'm the clerkship director now at San Diego, but was at BAMC for a number of years. And before that, I was a program director on the civilian side. So I guess I bring some experience from different sides of this.
Hey, and I'm Brian Schwarzkopf. I'm the new program director at Portsmouth. Or excuse me, rotation director. That's probably the better way to put it.
I just got fired.
Can't do that. I can't step into those shoes, Daphne.
You were promoted to moderator.
Yeah. Yeah, exactly. I was promoted. Well, we want to take questions here that are kind of Navy specific. I had a couple notes that I just wanted to like emphasize that I think maybe are somewhat unique to Navy, but maybe not. Please apply at both sites. Like we were just talking about, people communicate all the time, co-location requests, family requests, things that tie them to one coast or another. And we want to have that conversation with you, and plenty of people apply, and I'm like, we'd really love you to come here, but I totally understand you have to go to a different site, whether that's civilian or San Diego. So again, please apply at a minimum to both San Diego and Portsmouth, even if you don't think you want to go to one or the other. Don't try to play games with the mod system. So there's none of that, like, don't think like, oh, I'm only going to rank one program and therefore they can't send me anywhere else. So in case you don't know, the Navy can send you wherever they want for your internship, whether you rank it or not. So that's one thing. The other thing that I want to share, and we can talk about more, is that for the past 4 or 5 years, the Navy has offered roughly somewhere like 10 to 12 or 14 civilian deferment spots every year. So there's that's like growing opportunity as we look to grow our number of EM physicians. And to that, we've also added the spot at BMC that Dr. Matlock was talking about. So we anticipate there being one Navy active duty spot at BMC every year, again, through mods. And then finally, we touched on it a little bit, CAS versus ERAS. We've done a lot of work meeting with the Navy GME office. So I know that the BUMED note hasn't come out yet, but when the BUMED note comes out, we anticipate that that will give students guidance that tells them they must apply to a civilian application system, but it's not going to be linked directly to ERAS. And they've said that they will still reimburse one or the other. And so HPSP reimburses that application, and so you will still be eligible for that. So with that, I'm going to stay off mute and we can just kind of have a conversation. I think this is a small group. Dr. Schmitz, go ahead.
I was just going to add on. So the civilian spots are kind of NADS is the other name. You guys may have heard it if you're not familiar with that acronym. But one thing that is important there, I occasionally encounter students who like really don't want to stay in the military for residency. They want to do civilian, and they think if they just don't apply to either military program that they're just going to apply through residency CAS. That is not a good idea. When the selection committee meets, so that you're going to have representatives from both Navy programs there, and if nobody knows who you are, the chances of you getting one of those civilian deferred spots is pretty low. So we'd much rather you apply not only to both programs, but if you don't want to do military, then just be honest about like, hey, I really want to be a civilian. Again, my spouse is in Milwaukee, or like whatever it is of why you want to do that, and just be transparent so that we can really help you and support to make sure you're in the best program. But don't try and like game the system or hide or anticipate that you're not even going to tell us, because that will really hurt your chances of matching an emergency medicine like at all.
What questions do you guys have? We're happy to answer whatever's on your mind.
Hi, everyone. I'm our USIS applying EM. I was just wondering because I am rotating at both Portsmouth and San Diego, so hopefully we'll be getting 2 slows. Is it value added to get other letters past that?
I would personally say no, unless I think unless that letter is like speaking to something either like very unique or maybe some weakness in your application. Like if there's some, I don't know, challenge you ever came during medical school. In general, I think the 2 slows would be perfect.
Yeah, I agree. It's like they said in the big group. I think the slows are 99% of the information that is most valuable, for your rotation and how you compare to others in your group and the year before. And it's just the slow's a very valuable thing. I'm glad we have it as part of our EM application. And a nice letter is a nice letter, but it's not particularly informative about how you do in the environment that you will be in.
Thank you all. That makes a lot of sense.
And I know that.
Oh, sorry.
Go ahead.
I was just gonna ask, I see that one of you have put your Ensign who you put your year in, and I know Ensign Flynn is a fourth year, and you said what guys, what year in medical school are you guys?
Fourth year.
Four.
I'm also fourth year.
Okay, cool, good. Ensign who, you're getting all the good information.
I think they should a flow for the links. You guys could see what that looks like. But another thing I kind of want to emphasize is I think it causes a lot of stress for students about like, what is my slow gonna say? And what if I'm not like in the top 10%? There are, different like categories, but the slow is important that it gives us a lot of information. But you don't necessarily have to be like the top of the top. There's a lot of people who have really compelling life stories. They've done a lot of cool stuff. They interview really well, that they maybe did fine on the rotation, but they really shine in other ways. So if you end up getting a pass on a rotation, and half of our students get pass, and we have some really strong students that get pass, you don't necessarily have to get honors and everything to match an emergency medicine. And I want to take some of that pressure off of you guys as well.
Go ahead, Ensign Carr.
Hi. So just to address the elephant in the room, Kyle is my husband and we're in the same car at the same time. But I had a question that's a little specific to myself. Dr. Schmitz kind of knows, because I'm currently rotating on EM at San Diego for my clerkship. But I have since been convinced to the dark side and am now planning on interviewing here while I'm here. But I don't have an actual Portsmouth EM rotation scheduled, but I am going to be there for ENT, which is another specialty I'm interviewing in, still trying to figure out my life at the moment. Any recommendation as far as when I'm at Portsmouth doing a different rotation, if it's like worthwhile for me to kind of coordinate maybe a day on the weekend or something to kind of sneak down to the emergency department to kind of get to know residents in the program and such, or like what maybe is my best course of action to tackle this unique issue for myself.
Yeah, we would love to have you. I'll put our generic PD email in here again. This just ensures that like someone who's like not on leave or deployed will answer you. But this will get to me and our program coordinator, and we can connect you with our chiefs. A couple things, you're welcome to come to conference. We do conference every Thursday afternoon. We've had rotators that are like on a different specialty, like you described, come down and shadow either on the weekend or even in the afternoon, depending on what ENT looks like if you have some free afternoon. So yeah, we would be happy to connect with you. We're happy to interview you in person as well when you're at Portsmouth, as long as that kind of, most of the rotations are happy to support this. So if you tell ENT, hey, I have an interview at this time, they'll often cut you free for that period.
Awesome. And then I guess to follow up on Kyle's question about the slows. So obviously not doing a full rotation, I wouldn't have a second slow, but I'll have other letters of rec. Is that like, I guess any like course of action for me to do there, or just kind of that's like just to be expected since I won't do a full rotation at Portsmouth?
I can say from our standpoint, right, you'll have a slow from us, and you have another letter from your surgery rotation, your ENT. Again, that's where I think 1 to 2 slows is totally fine. On the civilian side, it's a little bit different, but for USIS, I think just having 1 slow, especially knowing that you're still trying to figure out what specialty you want to do with your life, is totally fine.
Yeah, agreed. We don't require any slows, but I will say most of our students have 2. All of them at least have 1 in general.
I'm going to put my email also in the chat. For San Diego, we don't really have much administrative support. So I'm sort of an administrator and the clerkship director. So for setting up interviews, just shoot me an email and I will get you guys interview dates if we've not already set up an interview. And for the first years, I see we have 1 first year student on here. It's great. Welcome. The biggest thing is knowing when to get your applications in. So December 1st is when sort of our GME office opens. And this year, kind of like Army, I saw at least an increase in the number of applications this year. And this is the first time that we had to turn a bunch of people away. Historically, it's been kind of a first come, first serve. So if you can get those applications in like pretty close to the beginning of December, that really helps us kind of figure out how many people are. And we were able to add an EM ultrasound rotation this year to try and accommodate some more students, and trying to be creative and different types of rotations so we can get as many people in. But the sooner the better. So as long as people are kind of tracking those dates, and I'll put my email also in the chat here.
Yeah, and just as a someone to keep in mind, even if at the moment you're not considering BAMC, we are more than happy to set up a virtual interview. We have virtual interviews on every day that we have interviews. We integrate them in, and we have a lot of interview days. So if you have any curiosity about us and want to learn about our program, we'd love to talk to you. Even if you just want to learn about us, we'd like to learn about you. So I'll put mine in the chat too, and we'd be happy to talk to all of you.
Yeah, we do virtual interviews now. We actually have been doing phone interviews for like well before COVID. I think a lot of people assume like we switched to virtual for COVID, but actually, with GMOs all around the globe, you were not judged differently if you in-person interview versus phone or virtual interview. And so, yeah, don't feel like you need to travel to Portsmouth if you are not rotating there. If you're rotating, we'll interview you on a rotation, and if you're not, please set up a virtual interview. What other questions do you guys have? Yeah, go ahead, Ensign Carson.
Good evening, everybody. So as far as ranking NADS, like after the three military spots, do people typically that rank NADS there, do they get the full EM deferment to do an EM residency, or do they usually get put in a 1-year deferment?
So if you select emergency medicine for NADS, it's for up to 4 years of residency training, and then you're released to participate and match into a 3 or 4 year civilian program, but then you go through the match. You could potentially match into a 1-year NADS prelim, in which case you're only authorized to apply to 1-year programs.
Thank you. So if I put NADS as my 4th ranked thing, it's going to be for the EM spot then?
It will be for emergency medicine, but because you have to do internship, in like a worst case scenario, if you don't match into any of the 5 things you rank, you could still get put into a different internship. That could be a different military internship. It could also be a civilian deferment for a 1-year prelim year.
That makes sense. Thank you.
Yeah, go ahead. You guys can just like unmute and talk. I mean, I'll keep recognizing hands too, but.
Thanks. So if I select going for a transitional year, because I'm currently living in Hampton, Virginia, so I'm hoping to stay in the Portsmouth area. And if I do a transitional year, what advice would you have to then match to emergency medicine afterwards, if I'm not a super strong straight through candidate?
When you say transitional year, do you mean like 1 year of emergency medicine, or do you mean into like a TY program?
Either one, really. I'm kind of just exploring all my options to hopefully stay in the area. So I guess either the TY program with the military or doing a 1-year emergency medicine internship.
Anybody want to take that?
For us,
Yeah. Oh, go ahead. Sorry.
no, I was just gonna say, I think it helps having people like tied into the specialty. So people who are doing research, or they're coming to journal club if we have kind of other resident events, if they're kind of trying to stay involved, usually working with one of the faculty members to get their name on a research paper and just kind of staying in touch with us. And in particular, our program director to say, hey, I'm still interested in emergency medicine. That helps kind of keep your name on the list. We typically will have 10 people who come straight through, but then we will usually have a couple spots of people who have been out or doing TY or kind of other things that come back. And those are typically people who have like reached out to the program director, stay connected to the program in one way or another, and getting kind of those extra points, which can be research, different things that kind of show that your service and commitment to both the military and to emergency medicine. But since you're interested in Portsmouth in that area specifically, I don't know, Daphne, if you have additional thoughts on kind of the Portsmouth area.
Yeah, the same thing. So when you apply, the Navy offers both continuous contracts in emergency medicine. They also offer EM 1 years where you are a categorical EM intern, but go to the fleet before coming back to residency, or you could potentially get placed in a 1 year TY or like medicine prelim year. And so I think if you match into emergency medicine, that's obviously like the best place to be, even if you match into just a 1 year of emergency medicine. We keep close contact with all of our interns. We track all of our interns that are out in the fleet pending coming back to Portsmouth. And then if you're TY or if you're looking at like what are you going to rank for your second specialty, I would highly recommend ranking sites at San Diego and Portsmouth. And the reason I say that is because there's no EM residency at Walter Reed. And so if you end up as a TY at Walter Reed, you don't have that opportunity to stay connected with other EM programs. And so if you end up at Portsmouth or San Diego, then exactly like Dr. Schmidt said, you can come to Journal Club, you can come to conference, you can get connected with mentors, senior residents to really stay connected in the field and like grow your application for, when you apply at the end of your GMO tour.
Yeah, and to piggyback off that as well, the transitional year also has EM track within it, where there's a few students that do a couple extra EM rotations through the year. So essentially, they are still a TY program member, but they still get to rotate in the emergency department just about as much as our interns do. So that's definitely another thing to consider.
I will say that's unique for Portsmouth. Dr. Auden, when he was program director here, felt like that would give some people an unfair advantage in San Diego. So we had a policy in place that TYs did not rotate in our emergency department, and we were trying to accommodate learners, and so that it makes it a little bit more difficult. So that would be helpful information to know if that's something you're interested in from a TY perspective.
Any other advice for a dual military? My husband is not medicine at all. So I guess any advice that you have kind of in matching and things.
Compromise and balance. My husband is ortho, so in medicine, a different field, and it trying to match civilian with military or civilian in your husband's job, whatever that is outside of medicine, it's hard. And trying to find the geographic, location that works for everybody. Is getting kind of his input. With the Navy, there's, sort of limited spots of where you can go. There's many more options for Air Force and Army for training. But I think having, frank conversations about what the commitment is, what the time is, kind of what that's going to look like will help him kind of plan his career and what his options are for his professional, job as well.
Did you say he's military as well?
Yes, he's Army.
Yeah, I would make sure that that's information in your personal statement because I guess I have two things. One, make sure it's in your personal statement. And two, read the Navy co-location policy because one of your lessons in being a military officer is like know what the policy says. And so technically by the policy, they don't have to co-locate you when you're in a training program. However, the Navy GME note mentions co-location and that they will essentially try to co-locate you. And so I would make sure that they know about it. And the only way the board really knows about it is that it's in your personal statement. And I think the other thing that's helpful, like Dr. Schmidt said, is that flexibility and kind of future planning. I would say there's a lot of dual military folks at Portsmouth. And they look ahead, they talk to people, they find out where the jobs are, they know your rotation, his rotation, where you can go, you talk to your detailers. And so it kind of goes back to that transparency and communication and hopefully you'll be successful.
Yeah, and we have, with having 3 services, we have a number of joint military, sometimes different branch spouses, one medical, one non-medical, and it helps on both sides to coordinate with well, what the Army would call a branch manager. Uh, there are often jobs in locations that aren't the ones that someone in a given career path might know about. And, sometimes like one of our residents who's Air Force, her husband is non-medical Air Force. He was able to get a ROTC instructor job, just a thing that existed as a one-off in San Antonio. And they both, I mean, we knew that, she made that clear to us that that was a priority. And but he was also, creative and just seeking out what was available to really broaden the possibilities about, having the full scope of what would be available on the non-medical side as well.
Awesome. Thank you all so much. I appreciate it.
I'm still listening, but I need to start dinner for my kids before soccer practice. So I'm going to put myself on mute and we'll chime in as I can.
Great. No, we can't hear you.
Can you hear me now?
Yes.
Okay. Thank you for hosting this. I'm Patrick, fourth year. I'm curious when the SLO is due. Is that mid-October or would that be before the board convening date? If I have a rotation ending early October, I'm wondering if I'm going to be able to get one in before then.
So all documents must be submitted to mods by that October 15th deadline. And so it's not the board convening date, it's when the application closes.
Well, thank you.
Yeah, of course. I'm going to put this link in the chat too. This link is to the Navy GME site. You'll find some stuff here about mods, the links for mods, the different deadlines, and the GMESB note when it's published will show up there as well.
So one more word of advice, do not wait to the last minute to upload your mods. Last year, like the whole system like crashed and was down for like a week and you never know like when it's going to work. So please try and like when you're on base specifically and have access to the computer to start kind of cracking away at that. And that way you won't be stressed out at the last minute.
Yeah, that site reliably crashes anytime a lot of people use it, which is right when people are applying to or to residency. So that's great advice.
The other thing I guess I'll bring up that we haven't quite talked about yet is the pilot program. Hopefully you guys are all tracking that a couple years ago, the Navy started a pilot program to match into a one-year internship, then have a 3-year break for a GMO tour, followed by matching into residency. That only applies to Portsmouth and San Diego, not the BAMC site. So if you match to BAMC, that's just a 3-year continuous contract in emergency medicine. But it's a good option if you guys were thinking that you really wanted to be a flight surgeon or dive medical officer. You can essentially match for that entire span of time, all as a 4th-year medical student, as opposed to waiting and reapplying each time you transition between them. And there's frequently asked questions about that Navy pilot program in that link.
As far as the pilot program goes, if you are considering it, and they don't pick you up for the pilot, are you automatically not considered for the full 4-year residency, or are you still available for that if they don't pick you up for pilot?
That is correct. You have to opt out of the 4-year continuous contract. And then, so if you applied for the pilot program and didn't get picked up for the pilot program, but matched into emergency medicine, it would be for a 1-year internship. I would love to see them change that. So the more feedback you send them that allows students to apply to both would be awesome.
And does that affect how we're ranked essentially by the programs?
The pilot program does not change your competitiveness in the match system or at the board. All right, other like burning questions? We have plenty of time, so we're happy to hang out and answer questions. Or you guys are welcome to follow up with us via email.
So I had another quick question, ma'am.
Yeah.
So as far as slows go, is there more weight to the military slows? For instance, I'm only able to rotate at Portsmouth and not, and my other one will be from a civilian program. Is that one weighed significantly more heavy, or is it better to have one from both, or how do y'all look at that?
Yeah, I think again, we don't necessarily require it. I think that statement that most have two, everyone has one. So as long as you have one or two, it doesn't necessarily have to, because we know not everybody could rotate, with us and likewise at Portsmouth. So as long as you have one slow, if you have two, great. But if you don't, that's okay too. And we would consider the civilian slow as strong as a military slow.
Thank you.
I agree.
Are all the programs sending every senior resident to GEMX now, like the joint EM exercise?
We've sent all our seniors for the past, I don't know, since before I was program director.
Yeah, we go. All of ours go.
We do too.
I think GEMX is great. It's probably some of the best training that we get, like on the way out the door, to have the seniors put it all together, lead a team through all the phases of care. If you guys don't know what that is, there's a joint emergency medicine field exercise hosted at Fort Cavazos, Fort Hood, Texas. It's Air Force, Army, Navy, and the senior EM residents go kind of right before graduation.
Yeah, there's like 2,000 people that are part of it, and the cadre are just the world's experts in operational EM, and it's really outstanding.
I'm kind of jealous they get to like fly in helicopters and like ride in 8-ton trucks and stuff.
Yeah. Yeah, and it's been going on a while. It's going to continue in perpetuity, so it's I'm glad everyone can go.
All right, well, we'll hang around here if people have more questions. And if not, thanks for joining. And this recording will get posted eventually with through GS ASAP or AAM.
Thank you, Dr. Ponce, for moderating. Great to see everybody.
Yeah. Bye, everybody.
Yeah,
good to see
Thank
you.
you.
Bye. Thank you.
Sorry for trying to take your job, Daphne.
Yeah, no worries.
Good to see you.
Yeah. Hey.
Hi, I actually do have a quick question, but I just kind of wanted, I'm only M1, so I wanted to make sure everyone else got their burning questions asked.
Yeah.
But yeah, I was curious about the pilot program. So if you apply for the pilot program for San Diego, does that automatically also or do you have to apply separately for the pilot program in like Portsmouth as well?
Yeah, so when you go to apply for residency in the system called MODS, which is our residency application system, you rank specialty and site. So for emergency medicine, you have kind of three options: Portsmouth, San Diego, and civilian. And so you would rank the three of those, 1, 2, and 3. You get 2 more spots, so you get 5 choices. It's not like the civilian match where you can like apply to 20 things. So you put 5 things. So your first 3 are going to be emergency medicine at the 3 different sites, essentially Portsmouth, San Diego, civilian. And then your number 4 and 5 will be, transitional or internal medicine or whatever you would want for a prelim year if you don't get emergency medicine. And then the pilot program is residency at that site for years 1 through 4. There's just a break in the middle. So for example, we have a resident who she just finished internship. She's in the pilot program. So she did internship this year, and now she's leaving to go be a dive medical officer, and she's going to come back to residency in 3 years. So it's like this, it's all part of the same application. There's just like a scheduled break in your residency.
Okay, I guess my clarification was so like I did overhear one of them say that if you apply for the pilot program, you're opting out of the traditional 4-year one. So would that just be for like Portsmouth, you can opt out of that 4-year, but then you apply for like at San Diego, you go for their 4-year.
No,
Just
it's all the same. So you can't apply for one or the other. You apply to emergency medicine, and by default, you apply for a 4-year contract. You can
okay.
opt out of a 4-year contract. I guess what you should know also is that the Navy in general just gives people 1-year contracts for all residency. And this shift to doing continuous contracts is new. So we have only had continuous contracts for the past like 3 or 4 years. Prior to that, all emergency medicine interns only matched for internship. And then during your internship, you would apply for your residency for your 2 through 4 years. And so this is kind of like a hybrid model. So we have kind of 3 different types of interns. There are interns that have a 4-year contract and they're there for all 4 years. Interns in the pilot program that do 1 year and are guaranteed a residency when they come back. And then there are interns who just have a contract for their PGY1 or emergency medicine intern year, and then they have to reapply to continue on in residency.
Okay. And they can also apply to go to like dive medicine or flight surgery. Is that correct?
Exactly. So at the end of that intern year, you could go out and you could go to a ship or go do flight surgery. And then at the end of your flight surgery tour, you would apply to emergency medicine and you'd come back to training. What the pilot program does
Okay.
is you don't have to reapply to residency while you're a flight surgeon or a dive officer.
I see. Okay. Thank you. That's really helpful.
Yeah. Yeah, of course. Brian, you want to add anything else? It's a complicated process for sure.
Yeah, I'd say the only other thing is if you like some people know like, hey, I want to dive or hey, I want to definitely be a flight officer. And so that's when they can get in the pilot program and they know. I would say if you're questioning like, hey, everything sounds cool, I want to try to get a spot as an intern and then like talk to people and figure out which I want to join, that is a good option too. And I don't think at the board, they're going to look at that any differently. Really, they want to get the 20 best emergency medicine, potential emergency medicine physicians in the spots in San Diego and Portsmouth. And then from there, it's up to you, like where your career path takes you.
Yeah,
Okay.
absolutely. Where are you in med school at?
I go to Nova Southeastern
Nice.
University, and I go to the Clearwater campus.
Okay.
So a nice one over there. I actually just finished taking my last M1 exam today, so I should be,
Oh,
I guess,
Nice.
M2.
Congratulations.
yeah, you get promoted too.
Yeah. No, but I really do appreciate you guys giving like just these resources. I actually found this through the Instagram page for Portsmouth on
Oh, yay. I'm going to tell Dr. Baker. She's going to be so proud.
Yeah, she'll be thrilled.
Yeah, I'm part of the executive board for my school SAMOPS thing, and I just want to make sure
Awesome.
that I have as much knowledge of this process to like inform or at least like guide people in the right direction um, next year for the future M1s. Because honestly, our school does not do a very good job of guiding it through this stuff.
Yeah, some
No,
of our
it's real
residents,
tough.
oh, I was going to say some of our residents are still involved in SAMOPS. So feel free to reach out and we're happy to connect military students because I don't know what Brian's experience was, but it's a hard process to navigate.
Yeah, no, for sure. I think that you read those different papers that come out and they try to explain it, but until you really live it or talk to somebody who's gone through it, it is really confusing.
Mhm.
And so that's why things like this are really helpful, and hopefully you got something out of it and got a majority of your
Oh no,
questions
for
answered. And
sure.
I'm sure that there'll be many more questions down the road. So save some of those emails and feel free to reach out.